Good afternoon, everyone. I am District 4 City Councilor Brian Worrell, Chair of the Committee on Small Businesses and Professional Licensure. It is Monday, April 3rd, 2023, and we are here today in the Ionella Chamber for a hearing on docket number 0630, order for a hearing to discuss the ban of miniature alcohol bottles, singles, in the city of Boston, referred to the committee on March 22nd, 2023, and sponsored by Councilor Ricardo Arroyo. This hearing is being recorded and is being live streamed at www.boston.gov/city/council/TV and on Xfinity ARCN 82 files 964. If members of the public would like to provide public testimony, they can sign up at the sign-in sheet near the podium to my left. Members of the public may also provide testimony via Zoom or provide written comments to the committee that will be made part of the public record and share with the councilors. Members of the public should email Christine O'Donnell at christine.o'donnell@boston.gov to request a testimony link for public testimony via Zoom. Members of the public can also email the committee, email at cc.smallbiz@boston.gov to provide written testimony. We need information for people who are providing public testimony via Zoom, via video conference, especially if you're dialing in with a phone number or if you have an unrecognizable username. So please make sure that your name appears on Zoom. I will now turn it over to the lead sponsor, Councilor Arroyo, for opening remarks, and then to my colleagues in order of arrival.
Thank you, Chair Worrell. I also want to thank our guests today from the Boston Public Health Commission, our licensing board, and also from the Chelsea, essentially Chelsea's well represented here, Chelsea City Council President, Police Chief from Chelsea, as well as our City Councilor from Newton, areas that have instituted a similar ban, Chelsea in 2018, I believe Newton's went into effect in 2021. And the reasoning for this, in terms of my bringing this before the body, is sort of twofold. The first being sort of a public welfare, public good issue where we have seen sort of proliferation of these singles and nips on the streets, in parks. In Hyde Park alone, I had a neighborhood organization, Keep Hyde Park Beautiful, that was able to collect 10,000 of these in less than 2 months. And that's an organization, that's a volunteer organization of maybe a dozen people. And so we're not talking about like crews all over the city, which means that the number that we're probably looking at in terms of total number of these just on the streets is in the hundreds of thousands here in Boston. And so, you know, I think there's a real public nuisance standpoint from that alone. But I think what really brought this over the edge for me was when I heard the public health concerns sort of that came out of Chelsea that led to their ban in 2018, where they had almost 1,000 ambulance or police or fire related calls based on alcohol, and within about a year of that they'd halved that number, if not more so. And so for me, the fact that this handled even one of those two issues would have been enough for me. The fact that it plays in both of those issues, I think, is an overwhelming reason to move forward with something like this. I'd also been made aware, even as a district councilor in my own district, of community groups and neighborhood groups when a new license would come before us, or a license for the selling of liquor in a neighborhood, people asking for this condition. Can you please advocate that we have this condition that they not sell singles or nips? And so through that, my staff was able to look through Analyze Boston and realize that there's, and I say a floor because it's not a full accounting, I'm hoping we get this number later, but that there's at least 70 businesses in the city of Boston that already have this condition. And so I would like to make this universal across the board. I'd like to have conversations about the decisions that went into doing that. And so I think that this is one of those issues where we get the ability to do some good. I have heard, the only counter to this I've heard, and I hope that folks who are here to represent this side of it can speak in the comments as well, and we hear you as well, is that there's a monetary loss for liquor stores or small package stores. But I would note that in Chelsea and Newton and all of the places that have done this, not a single liquor store has shut its doors, none have gone out of business. And I think that the public safety, public health, public good of that is worth whatever that trade-off is financially. And so with that, I'm going to thank you for your time. I have questions for all of you to dig more into all of these sort of talking points and aspects of this legislation. But I appreciate all of you being here and addressing this issue.
Thank you, Councilor Rowe. Now we'll turn to our Council President, Councilor Ed Flynn.
Thank you, Mr. Chair, and thank you to the panel for being here, and the administration team and the Chelsea Police Department as well. I'm here to listen, to learn more about the proposal, listen to both sides closely. What I would like to mention is a common word referring to the miniature alcohol bottles is also used as a slur against persons of Japanese descent. And at a time when we're seeing hate crimes against the Asian community here in the most progressive city in America, we're seeing hate crimes and anti-Asian racism. It would be appropriate to use a different term, such as singles or miniature alcohol bottles, but using the word that's currently used frequently is inappropriate. I'm here to listen, to learn from both sides. Thank you, Mr. Chair.
Thank you, Council President. And now we'll go to Councilor at Large, Councilor Flaherty.
Thank you, Mr. Chairman, and thanks to the lead sponsor here, obviously, to learn a little bit more about it. Some of my initial concerns are the impacts it would have on small businesses and family-owned businesses, the possibility potentially of expanding the state's bottle bill legislation, also the unintended consequences of forcing a customer to buy bigger alcohol containers up front. I know that we've seen a lot of it, the college students now. I can't even think of the name of the bottle that they use. They add, I think, Gatorade and other fruit juices to it. But obviously, I understand the goal of attaining a cleaner planet through litter removal is admirable, but this obviously will have major impacts. And also, in light of the fact that we give out, over at Mass and Cass, we give out a 4-needle pack, crack and meth pack, that these things end up finding themselves in the streets and the gutters and the parks and the playgrounds. And it doesn't seem to be as much outrage for the 4-pack as there is for the miniature alcohol singles. So I want to see if we can sort of have a discussion about bringing both of these together, if we're up in arms, if you will, about miniature alcohol singles, but we're not up in arms about the 4-pack. And we give out about 1 million of these a year, overseen by the Boston Public Health Commission. So it's great to see the doctor here. I'd love to hear her testimony, how she feels about the single miniature alcohol bottles, but also get the opinion on the 4-pack that gets distributed over at Mass and Cass to the tune of 1 million of these every single year that don't always come back safely. They end up in parks, playgrounds, ball fields, et cetera, putting a lot of folks at risk, in addition to making sure that it's litter as well. So anyways, look forward to hearing some of the testimony, and I'll reserve questions till the appropriate time. Thank you, Mr. Chair.
Thank you, Councilor. And we'll now go to Councilor at Large, Councilor Louis Jen.
Thank you, Chair, and thank you for this convening. I think that this is an important conversation for us to be having, and to have all stakeholders at the table. As a Hyde Park resident and as someone who's volunteered enthusiastically with Keep Hyde Park Beautiful, I can attest to what the chair stated, that during the process we pick up a lot of miniature bottles. So there would be environmental benefits, there would be public health benefits, and we have to listen to our small business community that I've been hearing from about the potential impacts on our communities and on our small businesses. So I'm here to listen. As an at-large city councilor, I hear from everyone, and I am here to listen to what everyone has to say. I also have gotten calls to my office about what we're doing here today and this week. There is no vote happening. We are here to have a hearing and to have a discussion. So I want to make sure that's clear for the record, that there is no vote on this today and that there will be no vote on this week. I don't believe it's actually squarely within our purview to even vote on this. We're having a hearing to discuss what this would be, what the impact of this would be on the city of Boston, and I'm here to listen to all of you. So thank you. I will not be able to stay for the entirety of the hearing, but I will be listening to it along with my staff. So thank you.
Thank you, Councilor Louis Jen. And now we'll go to District 6 Councilor Lara.
Thank you, Chair, and thank you to the sponsor for bringing this issue to the body. I'm here to listen and learn today, but I also want us to really pay close attention to the positive effects of this that we've seen in other cities. I think that as a body, we can walk and chew gum at the same time, and so our interest in this issue does not negate interest in other issues. And as you know, I, as a counselor, bring issues that are important to me and my constituency here to this floor. I hope and invite my council colleagues to do the same. I have similarly received both communications in support and against this, and so I want to see where the conversation takes us and find a solution that works for all of us, but keeping the health and well-being of our constituents at the forefront. Thank you.
Thank you. And I have a letter of absence here from Councilor at Large, Councilor Aaron Murphy. And it says, read it to record, Dear Chair Worrell, I am writing to inform you of my absence during today's City Council hearing on docket number 0630 regarding order for a hearing to discuss the ban of miniature alcohol bottles, singles, in the city of Boston. A representative from my staff will be listening in and following up with me. I look forward to reviewing the footage and following up as need be. I sincerely regret that I could not attend the hearing this afternoon as I made prior commitments that I must keep. And for me, as a small business owner, and also a lifelong Dorchester resident, this is just the start of the conversation. We want to make sure that we're balancing both. I've been on those walks where we have our main streets that are cleaning up the little tiny bottles out of the weed planters and the flower planters, but I also understand that the effect that this could have on small businesses. So it's here for a conversation, and as Councilor Louis Jen has stated, this is not going to a vote next Wednesday. This is just the start and initial of a conversation. And with that said, we'll open up to Dr. Ojukutu and Kathleen Joyce from the City of Boston.
I think I'm okay.
Yep, let me just read your title. Sorry about that. So we have Kathleen Joyce, Executive Director of Mayor's Office of Consumer Affairs and Licensing and Chairwoman of the Licensing Board for the City of Boston, and Dr. Basola Ojukutu, Executive Director, Boston Public Health Commission.
Good afternoon, everyone. Good afternoon specifically to Chairman Worrell and Councilor Arroyo and all the city councilors who are here today. And thank you for inviting me to join you for this really important discussion. I'm here today to provide some public health as well as clinical background on the manifestations and impact of excessive alcohol use and how this issue is specifically affecting Boston residents. I want to start off by commending the council for elevating alcohol use as a public health issue. Oftentimes we don't talk about it as such, even though excessive alcohol use is a leading cause of preventable death in the United States. I think it's also important for all of us to note that there has been a significant increase in alcohol intake, morbidity, and mortality since the beginning of the COVID-19 pandemic, most likely due to pandemic-related stress, mental health disorders, and limited access to treatment during lockdown. The CDC estimates that the annual total number of deaths due to alcohol intake increased 25% from 2019 to 2020, and then it increased another 10% from 2020 to 2021. And most recently, the total number of deaths per year in 2021, this is nationwide, was over 108,000. Adults aged 35 or older and males experience the greatest burden of alcohol-associated deaths, but certainly women and youth are at high risk. These deaths are largely due to the effects of chronic alcohol use, so cancers, whether it be liver cancer, breast cancer, liver disease in and of itself, as well as heart disease. Many deaths are also a result of binge drinking, and I think it's important for the public to understand what binge drinking really is. We tend to misunderstand that oftentimes. According to the CDC, binge drinking is consuming 5 or more drinks in one sitting for a man and 4 or more drinks in one sitting as a female. Unintentional injuries such as motor vehicle accidents, falls, alcohol poisoning, as well as violence, including homicide, suicide, intimate partner violence, and of course sexual assault, are also at increased risk in the setting of excessive alcohol use. Okay, so let's turn to specific data for Boston, because I think it's important for us to understand how this is impacting us locally. So at the Boston Public Health Commission, we monitor excessive drinking through our Boston Behavioral Risk Factor Surveillance System. Many of you all know this is a phone survey that we do every other year. So what I have is 2021 data. So in 2021, 23% of Boston adults reported binge drinking during the past month. but only 8% reported drinking alcohol at levels considered to be excessive by CDC definitions. What does that mean? So that's 30 drinks per month for females and 60 drinks per month for males. In 2021, there were more than 16,800 Boston residents who had to experience a hospital visit. So we categorize these as alcohol misuse hospital patient encounters, or the acronym HPE. So that means any hospital admission, emergency department visit, or any observational stay related to alcohol poisoning, abuse, or dependence. It's really important to understand that there are racial and ethnic disparities inherent to these data. The age-adjusted alcohol HPE rate, so that's the hospital patient visit rate, for Black Boston residents was the highest amongst all racial and ethnic groups, and 83% higher than the rate for white residents. In addition, from 2017 to 2021, the alcohol misuse HPE, the hospital patient visit rate, decreased for Asians, Latinx individuals, and white residents, but it increased for Black residents. Differences in hospitalization for alcohol misuse are also evident by gender. In 2021, the alcohol misuse HPE rate was 4 times higher for males versus female residents. I also have data in relationship to what EMS is experiencing, because I think that's important for us to understand. When EMS does it gets a call and they go and encounter a patient, they make an impression and get an understanding of what may be happening, and essentially what they've seen in the last year. In 2022, there were 7,980 interactions related to alcohol use, and that was up about 100 from the previous year, 2021, when it was 7,704 interactions. We can provide more detailed data and also look at that comparative to all of the interactions that EMS has after this hearing. So what do we do about this? What are the solutions? What does the evidence base say? So at the Boston Public Health Commission, our staff in our Recovery Services Bureau are engaged in a wide range of activities spanning the spectrum from youth prevention to outpatient services to referrals to recovery programs. You all are quite well aware at this point about the work that we do in regards to opioid use disorder. Well, those same programs are also utilized to refer people with alcohol use disorder to treatment, particularly detox, as well as medication-assisted treatment and counseling and other supports. So that includes PATHS, which is our Providing Access to Addictions Treatment Hope and Support Program. Walk-ins are welcome, first come, first served basis. We do work with folks who have polysubstance use disorder, as well as those who are only suffering from alcohol use disorder. In addition, we do prevention training in schools in collaboration with other programs, and as you all probably know, we do support the COPE Code Club, which provides comprehensive youth prevention support. I also want to highlight 311's work as a confidential 24/7 referral center for substance use treatment and recovery services, including alcohol use disorder. If you or a loved one are in need, I urge you to reach out today, call 311. I think it's important to mention that there is a role for regulation. So Boston is, as a city, recognized by City Health, which is a national ranking of city health policies, is having very strong protections in place to regulate alcohol retailers. I think it's important to recognize that Boston is a leader in this regard. It's also important to acknowledge that ongoing regulation of alcohol sales through the licensing board, which you'll hear about shortly, is important public health work. And lastly, I think that even though these issues of regulations and policies are important, I think that engaging in a dialogue about what more we need to do in regards to prevention of youth access to alcohol, discouraging misuse, and connecting our residents who are ready to seek treatment to services is of critical importance. So in closing, thank you again for giving me this opportunity to speak. I'm happy and would love to be involved in further conversations in regards to alcohol use and alcohol use disorder and what more we can do in this area, as are my colleagues at the Boston Public Health Commission. Thank you.
Thank you. And now we'll turn to Executive Director Kathleen Joyce.
Thank you. Thank you, Chair Worrell and Councilor Arroyo, for inviting me here today. I really want to make myself available for questions, but I can tell you now, since I have been chair of the licensing board, which goes back to October 2018 under Mayor Walsh, we have put a condition of no, no small miniature alcohol singles, and no singles in general on any package store license that comes before us. We ask the community to take that into consideration when there's a new application before them, and based on public safety and community feedback, we have been able to put this condition on licenses that come before us.
Thank you, Executive Director. Now we'll go to a round of questions in the same order of arrival. So we'll start with the sponsor, Councilor Arroyo.
Thank you, Chief. Chair, if I can just sort of bring up sort of the thing that was brought up that I think has no bearing or relevance here. Just to be clear, when we're talking about folks who are using syringes to take in drugs, can you just list out some of the medical concerns with shared needles? I believe it includes HIV, hepatitis. If you could just give me the whole list of what shared needles does.
Sure. So as you've already stated, so HIV, hepatitis C, and bloodborne pathogens. So we are giving up people needles as a source of harm reduction. Certainly we have seen an increase in endocarditis, which is when you inject a substance and it brings bacteria or other substances into your vessels and it causes damage to your heart. So we're trying to reduce the impact of those particular illnesses, those particular infections, and their spread in our communities.
And I believe I've seen the HIV numbers, but the difference between those numbers when we have a needle share program and a needle exchange program as opposed to when we don't, do you have that data available?
The exact data, I would have to get that to you here in Boston.
Is it
but
safe to say there's
it's
an
safe
increase?
to say, absolutely, absolutely. Harm reduction works, and needle exchange, syringe service programs are absolutely effective. And we here in Boston have been a leader in that area. We've been doing this since the late 80s, actually.
And so it's safe to say that syringes have some medical purpose?
Absolutely.
Is it safe to say that a single or a miniature alcohol bottle has no similar medical purpose? Can it be used to prevent HIV or the spread of any blood-borne pathogen?
No, it can't.
Okay. Can it be used to stop the spread of any disease that you're aware of?
No.
Is there any public health or public health good in the distribution of singles or miniature alcohol?
I don't think so,
Thank
Councilor
you.
Arroyo.
And so now that that's sort of taken care of, if we can go into the numbers for alcohol-related emergencies. Do you know what the number of alcohol-related emergencies in the city of Boston are?
So I have the numbers since 2018.
That's
I can
perfect.
give them to you.
Yeah.
But I'll just go backwards. So 2022 is 7,980. 2021, 7,704. 2020, 7,564. 2019, 9,384, and 2018, 8,272. I would say, though, that it's when you're looking at these numbers, it's important to note that these are impressions. So this is when EMS is encountering somebody in the field. We don't have sort of end data, meaning exactly confirmed what exactly was going on with that person, if it was just alcohol, if alcohol played some component, how much alcohol was consumed. But certainly these are the numbers that we have available.
And those numbers come from?
They come from EMS.
Okay, so those are numbers from, which they're very high, but those are numbers from EMS directly responding to what is considered an alcohol-related emergency.
Their impression.
Is there any other data that you can share on the level of alcohol-related emergency in the city of Boston?
I think these are the best data that we have, but I think what also might be helpful is showing these in relationship to the number of times that EMS interacts with patients. Everywhere you have a percentage of what of this. I think you gave that data for Chelsea, so we would like to provide that to you, and I think we can after after the hearing.
That would be great, because I think one of the major aspects of this is that there was a direct drop-off
Exactly. We don't
thereafter, and we obviously don't have that drop-off, but it would be nice to know where we are in terms
At
of the
baseline.
actual medical numbers. Are those numbers broken up by geographic location?
So we can get you those numbers by neighborhood.
Perfect.
I think we have them by zip code now in the EMS system.
That would be great. And so once you get that to the council, we'll share it out to the council. I might have more questions for you on the second round, but Ms. Choice, a couple questions. First, I know that Analyze Boston puts the number of total liquor stores that have this condition at 70, but we believe that's an undershoot. Do you know what the actual number is as of right now that have this condition?
We don't track that. We can actually go back through our files. Up until 2020, everything was paper files. One of the good things that came out of COVID in our office is we now have electronic files, so it would have to be a physical research project to go back and look at that.
And I think the current stance is that, what I think I heard, just to make it perfectly crystal clear, all new licenses that come to you or all transfers of licenses?
Any transfer or any new license that comes before me for a package store, I asked if they would voluntarily agree to a condition of not selling singles or miniature bottles. And I have never had anyone encounter that negatively. It's usually a conversation that happens at the community level based on community feedback. They said, you know, the new application comes before the community group, and they ask them to agree to this for public safety reasons or, you know, other community reasons as well.
And I have some of the decisions that have come back from the Commonwealth of Massachusetts' Alcoholic Beverages Control Commission. And so I believe, and I'm going to just quote from it, this is Chelsea, but I think it's probably also what they've used in ours. I know we've had 2 go up there. But in Chelsea, in their decision, they essentially make clear that licenses to sell alcoholic beverages are a special privilege subject to public regulation and control. And then in Chelsea, it looks like where they appealed was on the idea that this was a modification of the licenses they've already had. And the board makes very specific to them that the requirements imposed by the local board are not modifications of the licensees, because modification of a license is a sanction against a specific licensee for a licensing board's finding that the license violated the law, but instead that this is a local licensing authority pursuant to its authority to promulgate reasonable requirements for the way all licenses conduct their businesses, and thus banning the sale of 100 milliliter bottles of alcohol, and this is from Chelsea, was not a sanction for violating the law, but on considerations of public health and safety, and they upheld that decision for them. Is it safe to say that when the licensing board makes decisions about who and what in these sort of regulations, they're allowed to take into account public health and safety?
Yes, we
And
do.
in fact, you do that already?
We do.
Okay. And would you just speak to what some of the public health and safety, obviously if you've done this and you require this for every new license and every transfer of license, what are the reasons that the board has for requiring that of new businesses?
It's a reasonableness factor.
And-
Just what you're stating right there,
Yeah.
public safety and community concerns would be the things we take into consideration.
And so specifically, the licensing board is of the position that it is reasonable to impose this condition on new licenses and transfers
We have-
based on public health and
We
safety
haven't
analysis.
promulgated, you know, licensing board-wide regulations with respect to this. Every situation is different, every transfer is different, every application is different, every community is different, the needs are different. This is an asset of the business, and sometimes the sale of one of these licenses takes into consideration things like inventory. And let's say, you know, 30% of a particular licensee's inventory is these miniature alcohol singles. That is taken into consideration with the cost of what that license is. It's a private transaction between 2 parties. So that also is taken into consideration.
So I guess my question, and then I'll happily go around so that I'll just do a second round, but my final question on that is in the most Cliff Note version as you can, because I think there's a lot of folks watching this that have never even seen or know about the licensing board and the process that it goes through. What is the process that the licensing board goes through when it makes a decision to impose this kind of a regulation?
We have 3 members of the licensing board. We hold public hearings. The public hearings are scheduled. And at the hearing, they've already had a community meeting. And then we have an opportunity for people to come to our board and offer testimony in support of something, offer testimony in opposition. Things like conditions come up. Sometimes it's the applicant wants to stay open until 2 a.m., but the community wants it to close at midnight. Sometimes it's we don't want you to sell singles or miniature bottles. Sometimes it's please turn the lights off, the neon lights off in front at a certain time. Those are all sorts of conditions. This condition has a monetary impact to it, so we would really have to take a look at it through the lens of both sides here. Again, these licenses are bought and sold privately, and sometimes the cost of those licenses in that private transaction takes into consideration the ability to sell these types of things. I don't get into that. I don't get into what the cost of a license is. I wait until the support and opposition bubbles up to my level, and my co-commissioners do as well, and we take all that into consideration. It's a reasonableness factor. Is it reasonable to turn the neon lights off at 10 o'clock or to make sure that the doors are locked at a certain time? Those are other conditions we take into consideration.
Thank you. I think I'll reserve questions for round 2. Thank you for that. Thank you, Chair, for your allowance on time.
Thank you. And I will go to Councilor Flaherty. Councilor Ed Flynn.
Thank you, Mr. Chair, and Thank you. And thank you, Kathleen, for the responses that you provided and to your professional team that do an outstanding job working for the residents of Boston. My question would be to you, Kathleen, if this was implemented, would the current liquor stores that do sell these small miniature bottles, would they be kind of grandfathered in, or would it be liquor stores going forward that would not be able to sell them in the future? Do we know that?
It sounds as if this would be applied to all liquor being sold at package stores. We already informally require this of any new application or transfer.
Yeah, I've been on many hearings where I've seen this happen, and there's really there hasn't been any issues at all. So I want to compliment the licensing board. Is there any, I know what the positive situation would be if this was banned, but would there be any negative aspect to it? Can we think of any?
From the board's perspective, it's
From the
just an
board's
administrative task. I don't see anything negative. I mean, I can't put myself in the shoes of a licensee who currently has this as part of their business plan. I do know this was an important priority of Mayor Walsh, and he is the first person that I'm aware of that actually put something like this in place. And it's worked really well. We haven't had any negative feedback. As long as the applicant or the potential licensee is aware at the community level that the community wants this, there are no surprises at the board level. We want to make sure that as they enter into negotiations with the seller or with the community, that they understand that this is going to be required of them and not just the board coming down and enforcing something on them. That has been my approach since the beginning. And if they get to the board and they didn't know that I wanted to put this condition on them, I asked them to go back and work it out with the community.
Mm-hmm. If this was implemented, would you need to hire any new staff to investigate any potential store that would
No, I
be
don't
still
think so.
selling them?
I don't think so.
Okay. Okay, thank you, Kathleen. And Dr. Ojakutu, I know you discussed the public health aspect of this issue. Is there anything in your study or any research that you and your team have done where this issue is more prevalent in a particular neighborhood or with a particular group or a particular area of the city, maybe?
In terms of the mini alcohol bottles and environmental refuse and that sort of thing,
Yep.
I don't have that data. I think that would be interesting to get a sense, just environmentally, if that's more of an issue. What we have is really more about alcohol use, excess use, hospitalizations by neighborhood. So I don't have it by neighborhood.
Okay. Or what about from public health challenges, public health issues, medical issues, a particular neighborhood has based on the
Alcohol use?
Yeah,
Okay, so
based
I
on that.
do. So from the behavioral risk factor surveillance study in 2021, when compared to the rest of Boston, the alcohol misuse, this hospitalization rates that I mentioned, were higher for the South End, higher for Roxbury, and higher combined for Dorchester, but also higher for the areas Back Bay, Beacon Hill, West End, North End, that combined region. So it's really something that affects most of our city in different ways.
I represent a large immigrant community in District 2. What impact at all would this have on the public health of immigrants in the city, maybe in my district, but also really across the city, I'm asking?
So I think that any population that has been made vulnerable is going to be made vulnerable by any of these issues that are concerning, you know, and that have disparities. And I talked about racial and ethnic disparities, and that includes immigrant populations. I specifically gave data in regards to race, and certainly we have a large non-U.S. born population here in Boston that is Black, and I was able to give the data in regards to hospitalizations and misuse deaths that are higher amongst Black individuals, which I think is really important for us to note. I think we have to be careful, though, in assigning, you know, any sort of negative stereotypes or issues to certain populations. So I would be very careful without having the data right in front of me of non-U.S. born individuals to say that any issue, particularly this one or any other substance use issue, is more prevalent within any population here in Boston specifically.
Thank you, Dr. Ojukutu. Thank you, Kathleen, and thank you, Mr. Chair. I have enough.
Thank you, Council President. And I have one quick question for Executive Director Joyce. If this policy was to progress, what would be the role of the board in community engagement or implementation of the creation of said policy?
We would need to promulgate citywide regulation on this, and we would issue some sort of new rules and regulations to our licensees. The question at hand would be whether or not it's a reasonable request of our licensees, and that's what is still unknown. It hasn't been challenged in court, and it could be challenged in Boston.
Got it. And would there be like a community process to hear back from some of the licensees, or?
We would have a comment period for any of our changes to our rules and regulations. We would take them into consideration. We'd have a public hearing on it, and then we would issue a change or update to our rules and regulations.
Thank you. And now we'll go to Councilor Flaherty.
Thank you. Thank you, Mr. Chairman. Doctor, on the issue of banning signals, do you feel that it's more of a litter, an environmental issue, or a public health, public safety issue, or do you think it's all of the above?
I think it's all of the above, but I would also caveat that statement by saying that there isn't a large database of this and the impact of this intervention on clinical outcomes or environmental outcomes that I've seen. I think that people are doing this. As we said, we've heard great data from Chelsea. There's data from other locations. I know Chicago has a program, a number of other locations. But in terms of having a large database that I can tell you evidence-based says that we should do this intervention and it will lead to X outcome. I don't have that. I look forward to that information because I think that would help us to make decisions like this.
Commissioner, do you know how many singles we sell in a year?
I have no idea.
So we have no data on how many of these things are
data.
sold across the city, just for Boston?
No, I don't.
All right. And Doctor, one of the points I was making earlier in terms of the Boston Public Health Commission's, I guess, reaction to the banning of bottles, and obviously in putting it on par with the distribution of needles. For me, obviously, and for folks that are watching or here, this issue, for some it might be litter, for some it might be a public health issue, for some it might be a public safety, it could be an environmental issue, it could be, as I had referenced, all of the above. And you had referenced in your earlier comments that the banning of the single bottles was to sort of help fight the alcohol use disorder issue. And so with that, you had some previous questioning in terms of obviously the offset, I think, of the use of hypodermic needles, et cetera. Is it fair to say, obviously, the public health concerns around alcohol abuse and alcoholism runs from liver disease to kidney disease to heart failure to domestic abuse to operating under the influence of alcohol, which could obviously lead to motor vehicle homicide, things like that. So it could morph into sort of a public health, public safety issue, right? And so one of my issues or concerns is that it seems like the Public Health Commission seemed to kind of come right out of the gate, you know, in response to this particular issue in terms of discarded nip bottles, but not so aggressive with respect to the discarded needles. And I would only say that, I guess in your opinion, is it more dangerous to step on a discarded needle, or is it more dangerous to step on a discarded nip bottle?
Well, I think this goes back to what we were talking about in terms of transmission of bloodborne pathogens. So we know that that is one of the reasons that we do syringe service provision and that we, make sure that we collect our syringes using our mobile sharps team. And we actually collect 3 times as many that we actually give out. So we really do an aggressive sort of program here in Boston, which I'm proud of. I think it is dangerous to get stuck with a needle, and certainly not only, there is a risk. Depending on how much blood or what's left in the actual needle and the bore of the needle, there's certainly a risk there. So we are very aggressive about that, and harm reduction is important from that standpoint. So it's not just important for the individual, which I was explaining to Councilor Arroyo, but it's certainly important to the community.
So is it fair to say it's more dangerous to step on a discarded needle or to handle a discarded needle as it is to handle a discarded single?
I would say it's much more dangerous to handle a needle and potentially get a bloodborne infection than it is.
And so
to
my
handle
issue obviously is just, and obviously in that sphere of everything with the Public Health Commission in terms of their involvement with respect to banning single bottles, as well as obviously make sure we're collecting these, right? And the material that goes on the street as a result of this. So we're treating substance abuse a particular way. City is overseeing the needle exchange piece of it. We're also in the process of that. So for me, it's all relative in terms of if we're going to take the public health, public safety approach, and we're going to move aggressively to ban single bottles because of those issues and health concerns around that, liver disease, heart disease, alcoholism, motor vehicle homicide potentially, domestic abuse, as well as we're also going to be, if we're going to be distributing 1 million of these, and we're going to double down our efforts to make sure we collect those as well. So we're in it for public health, we're in it for public safety, we're in it for litter in the environment, but that it's under that same lens of we're going to be as aggressive in collecting these. Arguably, I would say we should be more aggressive because you just testified that it's actually more dangerous to handle and step on one of these as it is opposed to that. So just to sort of bring it full circle for my colleagues, for those in attendance and for those watching home, not a gotcha moment. It's I'm passionate about these being cleaned up as much as I'm passionate about, and I want to make sure that this doesn't get lost, or that this takes a premium over growing up around alcoholism and having relatives that have suffered from alcoholism and the myriad of issues that flow from that should not be minimized or discounted in either a comparison of a bottle pickup or a needle exchange pickup. So it's all to the individual holder, I guess. It's to that individual person and their family. And for some, it's alcohol abuse, and it's curtailing those activities. And it's a whole myriad of diseases that flow from alcoholism and alcohol abuse, as well as the potential diseases, bloodborne diseases that can come from a needle. But nothing worse, I think, than someone unsuspectingly, a child stepping on this, or one of our law enforcement or public safety or public health professionals getting pricked by one of these. That obviously causes a whole other type of sort of trauma and hysteria, as opposed to seeing a discarded single on the ground or a bottle that can't be recycled. I put it in the same sphere as a travel size mouthwash. Can't do that with either. So you see those things on the street too. But anyways, that's my point. Just want to bring it full circle for folks. So I appreciate your time and attention, Doctor, to the details. And if there's a way through the commissioner to get a count, I mean, I would assume that we could reach out to vendors, get a sense as to sort of what their inventory is and what they do. Maybe even we can get a sense from them how many of them they sell a month. And then we multiply that by the number of stores that sell across the city. To kind of, so we can at least quantify this. So we know that we give out 1 million of these 4-packs a year. We don't know how many single bottles we sell right now, but we're going to ban them. We're not banning these, but we're banning them, is my point, I guess. And so if we could get, I guess, some data around.
Yes, we can definitely get some data.
Yeah, data helps this council, obviously, and will help, obviously, determine how I would vote on this issue. But thank you both, Commissioner. Thank you, Doctor. Thank you, Chair. Thank you to my colleagues. And thanks for those that are in attendance.
Thank you. And with that, we'll move to District 6 Councilor Lara.
Thank you, Chair, and thank you both for being here and for your questions. So we're talking a lot about the impact on small businesses. Have you seen at all what that impact could possibly be as the licensing commission has moved to request that the new applications, the new selling and the new transfer of licenses
Can you elaborate what you are calling
Well,
impact?
have you seen that any of the 70, I think Councilor Arroyo said that we've had 70, but he thinks that that number is low, of the 70 licensed liquor stores that are not permitted currently to sell the miniatures, that they've either gone out of business or seen some adverse effect to their business because of it?
We haven't surveyed them to find out what the impact is of this. This is just one of, several conditions we would put on someone's license, so we don't track this. We haven't tracked it.
Yeah, because it's just one of the possible conditions that you put in. Now, you mentioned that there is a conversation, that is a consideration. The ability to sell the miniatures is a consideration that is made in the sale. Can you
It's a
elaborate
conversation
more?
at the community level.
At the community
When
level?
someone is looking to apply or purchase a liquor license, they have to go to the community, and they would discuss that with the community. Hi, I'm the new owner. I plan on buying this from, Mary, and these are the hours that we're going to be operating, and this is my experience. I'm familiar with the rules and regulations of the board. I'm familiar with the rules and regulations of the ABCC, and this is my plan. I'm going to renovate, or I'm not going to renovate, and the community, leads the discussion there. And more often than not, I would actually say probably all the time, the community asks them to, what their position is on selling these miniature alcohol bottles and singles.
So it's not the monetary impact that's taken into account, it is the community impact that's taken
Yes.
into account
It's
during the sale?
It's community impact, it's public safety. I don't get it, as a regulator, I don't get involved in the private sale. I look at whether or not it's appropriate to have a license at this location and whether or not this person is an appropriate license holder. I don't get into the sale. I don't get into any of those negotiations about whether or not they sell miniature alcohol bottles or not. It's something that bubbles up to the board level at the public hearing based on public testimony, based on community input and public safety input.
Okay, thank you. And I think that's my question here, because my question was about the impact. And if you knew the price was being negotiated based on their ability to sell miniatures, but you said that you don't get involved in the private.
I don't. It comes to me long after that.
Yeah, great. And you talked a little bit about this, if this were to pass, the possibility of it being contested in court. So would it be the court's decision, if it was contested in court, it would be the court's decision on whether or not this would be considered a reasonable request?
I believe so.
And if it's not, then it would just continue? But you think for sure it will be?
I'm not, what are you asking me?
If it was brought to court?
If the citywide ban was brought to court?
Yes.
I can't hypothesize about what the court would say.
My question is whether or not you think it would be brought to court.
I think it would be brought to court.
Okay, great. And it would be the court's decision ultimately on whether or
Yes.
not it was considered a reasonable request. I think that is all my question. I think my last question is for Dr. Ojikutu, because we continue to have this conversation about what we're investing in and prioritizing in. At the Boston Public Health Commission, I know that we have a number of needle return programs, and I know that you have needle pickup programs, and I know that either the Public Works Department or parts of the Boston Public Health Commission go to parks and areas that are high risk and go pick up needles. So you would say that there is at least a monetary and people investment that's happening on behalf of the city right now to clean up needles.
Absolutely.
Would you say that we're making the same kind of investment to clean up these miniature alcohol bottles?
I have to say that I have not, I don't know from DPW's standpoint what exactly they're picking up and how much they're picking up on a routine basis. I don't have that data. What I know is that we are making a significant investment in our mobile sharps team and our community syringe redemption program and in other services that we're doing on a daily basis, as you well know. So I would need DPW to say more about what they do in terms of picking up.
But in the term of prioritization, we are very much prioritizing, given the impact of needles in the neighborhood, we are prioritizing the pickup of
It's a
needles.
priority.
Great, and we are putting financial resources of the city
Absolutely.
to make sure that those are picked up. Great. I think those are all my questions for now. Thank you, Chair.
Thank you, Councilor Lara. Now we'll go around for a second round of questions. If you have a second round, please put your lights on. But we'll start with the sponsor, Councilor Arroyo.
Thank you, and I'll just say that I'll advocate for the budget to make sure we have some more DPW and some more sharps pickup. I think it's important that we get both, so I'll make that a part of my advocacy as well. Quick question on the medical emergencies. I thought those numbers, the most recent ones, sort of looked like they made the exact same spike that you referenced, that 10%, 35%. So,
Well, okay, go ahead.
so it looks like it went somewhere from 7,000, then with a high of about almost 10,000, close to
No,
9.
no. So in 2022 it was 7,980. So it did increase from 2020 to 2022. There was a decrease actually from 2019. But remember, I guess I should say, what I was talking about earlier was really looking at national data. And
yep.
really, I'm talking here about what EMS is doing on an annual basis in regards to alcohol-related incidents that are impressions. That makes it a little bit more difficult to compare those data in terms of percentages, but clearly there has been an increase from 2020 to 2022. Let me take a deeper dive into these data. Like
Please
I said, I
do.
think that would be helpful
Yeah, that'd be great.
for the body to understand.
Here's why I'm asking. Part of it is, what other, so obviously I think when it comes to alcohol, leading cause of death, there's a lot of, one of the things that has been, it sort of seems like obvious when you do it, but a number of the outreach that I've received is how these miniature bottles are preferred by people who drink and drive because they're easier to conceal from law enforcement and they're easier to dispose of out of a window, which is why sometimes you find these on the streets. And so that's more anecdotal, but what I would love to know is what percentage of EMS contacts related to drugs versus alcohol, what that percentage is. So for instance, one of the things that was striking to me was that the overdose numbers, I think the way this came out in Chelsea, and when they come up we'll have this question, but what led them to this was that they were actually investigating opiates and sort of overdose statistics, and it turned out that the alcohol statistics were like way past that. Do we have anything similar here?
So we have narcotic-related incidents,
Yep.
and we have them both annually and within months, and so we can get you that in a table. So you
Yep.
can kind of see the narcotic-related incidents versus the patient interactions that are thought to be related to alcohol, and you can compare the two. We also have opioid-related deaths, and
Yep.
you can see that for here in Boston.
And do we keep sort of alcohol-related deaths in the sense of like DUIs that end up with folks who are like who have intoxicated themselves to the point where they're driving and crashing and having fatal accidents? Do we have
So
any
that
of
would
data?
be, I would
Would
need to
that be
check with
BPD?
EMS, but I think that is actually on the hospital level, because they would actually know that alcohol had been consumed, and it may be
Through the
part of the picture of what led to the demise of that individual, not the whole picture necessarily.
Another concern that was raised for me were from parents who said that one of the issues with the singles, which is something that was sort of new to me, is that singles, one of their main selling points is that they're concealable, that they're easier to hide, they're harder to see, and that there was a concern with youth sort of preferring these singles because they're smaller, easier to pocket, easier to get into schools. I think I remember when folks were having the cannabis as a gateway drug conversation, that a lot of the data showed that the actual gateway to more hard narcotics was actually alcoholism at an early age, or alcoholism in general. Is that data relevant here? Is there actually a correlation between alcohol abuse at a younger age and heavy narcotic use later in life?
So there are data that have demonstrated that substance use early in life does predispose to substance use later in life. I mean, that I think has been well documented both from our behavioral risk surveillance studies, and we have like a youth surveillance study that has been documented. But I don't know that it specifically relates or even mentions this mini alcohol use issue. And I think that's one of the things that I would just maybe sidestep from just a little bit, just because I think we need to understand more about what this particular
Niche.
exactly, what does that really mean?
And so one of my questions for you is, do we have data on youth alcohol incidents? Do we break it down to that level where we actually have data on what those impressions are for
From
youth?
like EMS?
So like literally 18 and under, like under the legal drinking age.
So I'll have to talk to EMS and see if we can
See
get
if
this
they
by
have
age.
that number as well.
Yes.
That would be phenomenal. Thank you. Because I know
We'll
one of
get
the
that to you.
concerns that was brought up to me was from parents was that the reason that these end up in parks and playgrounds isn't because grown-ups are bringing them to parks and playgrounds. And so it would be very interesting to see if there's any data that shows any impressions based on sort of youth in age. Obviously, it's not going to break down to how they received that alcohol or what kind of alcohol they received, but I think it would be, for this and for other
take a look at that
reasons,
data.
good data to have. And then on the licensing board side, just in terms of this going to court, they would be looking at specifically whether or not it's a reasonable requirement. That's the legal standard, correct? That they would be questioning essentially whether or not the ban of a single or a miniature is a legal, reasonable requirement.
Tied to the entire city.
Yeah.
Reasonableness as it relates to the
Entirety of the city. And is it fair to say, back here or here, whichever way we want to go on this, that alcoholism and related events of public intoxication or public littering or public nuisance or crime, those aren't restricted to any one part of Boston, correct? Those are universal issues for the entire city. Is that fair to say?
I think so, yes.
And so is it fair to say that if singles and miniatures, which, members of this council have raised concerns about on an individual basis in their own communities, if that is true in one community, it's likely true in all communities, those same sort of grounds, the littering, the public intoxication, the impact of public health and safety, that those same concerns, say in Hyde Park, would be shared by a Rosendale or a East Boston?
I wouldn't go that far.
Well, here's why I ask.
So,
Here's why I ask. On the data we already have, every single neighborhood in the city of Boston has banned at least one or two or more of these establishments from selling singles and miniatures.
I would guess, but I
No,
don't
I know. I already have this. This is from Analyze Boston. So eventually when you send me the numbers, we'll be able to say just how much. But just off of Analyze Boston, it's every single neighborhood has at least one. And so if each neighborhood is using as a reasonable requirement the public health and safety, then it's safe to say that it's a citywide issue if it's been done in every neighborhood at least once. You don't have to.
I wouldn't go that far.
So what would you say that is indicative of?
I don't think you could make blanket statements across the city for any of these conditions of licenses. I don't
And
think
so-
you can make a statement that public safety in the neighborhood's the same or at the same level as it is downtown. I'll tell you, every single Tuesday when I have a violation hearing, I don't have the same violations
That's
across
fair.
the city.
Yeah.
There are upticks in certain neighborhoods of certain types of violations.
That's fair.
So I can't say this
Here's why I'm asking.
to be true.
Here's why I'm asking. When the licensing board takes into account the banning of a singles or miniatures for a liquor store or a package store, what's the area or circumference of impact that they are actually looking at? Is it just that street? Is it that corner?
I don't know. I don't take out a map. I listen to the community feedback. So when this licensee goes to a community meeting to
Yep.
talk about their license, I listen to what happens at that. I'm informed by the discussion that happens at the community level. We don't survey the neighbors and say,
So there's no
"Do
like
you
a
want
butters
this?"
request the way you would with, say, a development where it's like, this is coming in next door and would you like to speak
No.
on it?
No.
So there's no sort of mandatory notice that goes
There
out?
isn't a mandatory notice of an application coming before the community.
Can you explain that process? just so
Sure,
that
it's an
folks know?
application that says, there's an application for a transfer of a license, there's an application for a new license.
Yep.
There's an application for a change of hours, and they have a certain number of, butter notifications they have to send out.
Do you know what the size of that abutter
I
notification is?
don't know.
Thank you. I think that's it for me on those questions. Thank you. Thank you for your time.
Thank you, Councilor Rowe. Now we'll go to Council President Ed Flynn.
Thank you, Mr. Chair. And again, thank you to Kathleen and the licensing board for their professionalism. So my question, Dr. Ojakutu, I know we're having this comparison between alcohol and drugs in the shops. So I guess I'll ask a couple of shops questions since that's also part of the conversation. So how much, and I reference this because we're going into the budget season now, and it's important that we have the necessary resources to pick up shops, and we're hearing frequently that many of our parks are being subjected to so many of these needles discarded, and kids can't play sports. Having said that, what is the budget for shops pickup?
I don't have the actual number on me. I'd have to look it up, and I can also give that to you after the hearing.
That would be great. And I ask that because I really don't think, and I don't mean to call out my colleagues, but I really don't think the city council is doing enough on needles in parks. I think we need to do more. I think we need to advocate for more shops pickup, support, resources. This is a critical issue. Playing, kids playing baseball in the summertime, or kids playing basketball, or kids, or seniors. I see a lot of seniors walking in parks as well, kids on playgrounds. But I really think we need to do more in terms of shops pickup, and I think it needs to be a priority from this body, from the city council, to focus on this issue, to stay focused on this issue, because this is a quality of life issue. This is a quality of life issue. This is a public health issue. It's a public safety issue. And we're also not giving our kids an opportunity to play sports because of so many needles in our parks. So I'm gonna ask my colleagues if they think it is a priority, that we need to make sure we have the resources to deal with this. So I guess my question, Dr. Ojokutu, are you comfortable with the amount of money you have for shops pickup in the city, or do you think you need more?
So I think that it's an incredibly important issue, and it has been a priority, and certainly we could use more resources to put more people on the street, to put more services out there, to make sure that there are no needles that have been discarded. And both our Mobile Sharps team and our Community Syringe Redemption Program could use more funding.
And how many people do we have on that team?
I'll have to get the exact number. I don't want to give you the incorrect FTE.
Is it a dozen people or more? Mm-hmm. Do they work on the weekends?
Yes.
How many people are working on the weekends?
I have to break that down for you in a
Okay.
post-hearing memo.
My priority is, as we go forward during the spring and summer, when kids are playing sports in parks and using parks and kids are at playgrounds, that's when we really need to redouble our efforts on shops pickup. So I think it's a priority, and I think our councilors need to do more on this issue and be more engaged. Thank you, Dr. Ojokutu, and thank you to Kathleen. Thank you, Mr. Chair.
Thank you, Council President. And now we'll go to Council at Large, Council Flaherty.
Thank you, Mr. Chairman. Just want to double down on that, it was prior to your tenure, Doctor, and prior to most of my colleagues coming to the City Council, that this body, the Boston City Council, have supported the SHOPS program since its inception, and I led efforts several years ago to increase that team, to make sure the team was expanded and funded, but and also have seen it in use in terms of when folks have been there, have called 311. They are super responsive.
They are.
That team gets there. I remember the specific instance that I was involved with. I want to say they were there within 6 to 10 minutes, which was, I think they told me that was either average or might have been a little off that day. They are on it. So kudos to the SHOPS team that they get pulled in a number of different directions. And the reason we did that was because so many needles were finding their way to parks and to playgrounds and to ball fields and to the beaches.
That's right.
And so, I want to make it known that the correlation, I guess, between needles and these single bottles is they rarely make it home. Whether you're buying a single bottle or you're getting the 4-pack, they rarely make it back to where they got it from. And so as a result of which they end up in the street, in the gutters, in the parks, in the playgrounds. So we have a responsibility to double down our efforts. So I'll work with all of my colleagues and you to make sure that there's appropriate funding and or that the manpower and the FTEs are there and they're commensurate with what we're hearing. And I hear it citywide as an at-large council. I get calls from every corner of the city with concerns around finding of the needles. So, and then also I know that we oftentimes sort of look at the single alcohol and we sort of, I guess, attribute that to youth, but we know that that's also not the case. And I think you're seeing it now with young kids and young adults, and I couldn't think of the name in my opening, but they're calling them Borgs.
Oh, yes.
So it's actually now, it's like a full liter
Yes.
of alcohol plus, you know, a Gatorade packet or a, Pedialyte or something to give it like a colory, fruity flavor, and then, you know, and they're participating in this Borg process, and in a relatively short period of time, these kids are in real trouble, finding themselves in real trouble, and from a public health standpoint, but and many maybe getting themselves into some public safety trouble. So again, from an education and awareness standpoint, you know, making sure that if we could somehow get a sense as to how many of these single bottles are being sold in Boston and what that demographic around that is. And I think it might run the gamut, but I think initially we thought it was sort of kids when they were sort of starting out, going to a high school dance or something like that, or they're going to hang with some friends and they're going to mix it with some soda. I'm not quite sure that that's the case anymore, given that we're seeing all these other things that are happening, plus the pot and the edibles. It's all, everything's been sort of, I guess, destigmatized to the point where I guess it's a free-for-all out there with respect to young kids and young adults getting their hands on, or what they're going to try first. You know, is it going to be a single bottle? Is it going to be an edible? Is it going to be pot? Is it going to be a Borg? Is it going to be something worse than that? So, but we have a responsibility, one, to protect them and to provide education and awareness around it, and two, make sure that you and your team and the commissioner and her team have the resources that they need to keep up with the flow here, because it's fast-paced and ever-changing. But I just want to let it be known that this body has always supported that program. They do great work, and I had led efforts to increase that capacity several years ago. It's dating me now. This might have started, maybe the shots was like 2015-ish, 15, 16, and then I think in 2019, 20, we passed some regulations around the pharmacies as well.
That's right.
So we've been on it. This body's been on
For
it.
a while.
There's been a partnership with the Public Health Commission. So I want to make sure that that's not lost in this hearing, and making sure that
That's
we're,
great work, and we appreciate the city council.
and I
for that
thank you
work.
for that. And it's a collective effort, and it's not just about the bottles and discarded, but if we're gonna look at this, we need to have it go in with our eyes wide open and do the sort of the full 360 and identify other areas where we may be deficient or we could
That's right.
increase our efforts. Again, it's all, our success story is about partnerships, it's about collaboration, and making sure that we stay focused on things. So I
Absolutely.
appreciate that. Thank you, Doctor. Thank you, Commissioner. Thank you, Mr. Chairman.
Thank you, Council Flaherty, and now we'll go to Council Lara.
Thank you, Chair. I don't have any further questions for the panel. I just wanted to reiterate my support at the request of my council colleagues that the City Council needs to put more effort and/or attention to needles. The Sharps programs are at the park. I am sure I've held, as the chair of the Parks Committee, at least 2 hearings in my tenure here on the City Council that have been specifically focused on needles in the park, particularly at the parks around Mass and Cass. And I'm sure that Councilor Bach, who is the chair of the City Services Committee, and myself as the chair of the Park Department, would be more than happy to hold hearings if any of my council colleagues see it fit to file a hearing order to continue this conversation. I'm really grateful for the work that has happened here before I was elected as a city council, and obviously this is an ongoing issue that's going to take more than us checking in about it every few years. So just wanted to extend the invitation that I'm happy to hold any hearings or provide any support if any of my colleagues see it fit. Thank you.
Thank you.
Thank you, Councilor Lara, and that's music to any department head's ears right before budget season. So thank you, panelists, Dr. Ojikutu and Executive Director Joyce, for joining us here today in your testimony. Thank you. And while we are taking the next panel, who is Council President Roy Avalenda. Avellaneda.
I'm going to do that one. It's Roy Avellaneda.
Yes. Chief of Police Houghton, Street Navigator Owens, and City Councilor, they're not here.
No, Emily Norton.
Oh, Emily Norton, City Councilor Emily Norton.
Yeah, she's also,
Lead sponsor.
she's the River Watershed Association Executive Director of the
Also that again when I get there. But in the meantime, while they're setting up, we're going to do a few in-person hearings. So if Steve Rubin and Victoria Gall can join us down for testimony.
Sir, right here.
Yep. And if you could just state your name and any associations, and you'll have 5 minutes.
Okay, Stephen Rubin. I'm on the owner of Huntington Wine and Spirits, one of the oldest stores in Boston, established 1936, still trying to survive. I also represent the Massachusetts Package Store Association, which we have hundreds of members here in the city of Boston. I have a few factual data facts, but first off, I am surprised, very surprised that we didn't have more notice of this hearing. I think it just came about on Friday, and we would have had more retailers here to speak about this if we had more time. So I'm asking that we do have another hearing to have a discussion so more retailers can be involved in the city of Boston. A few facts. The public-private partnership works phenomenal in the city of Boston. About 17 years ago, the Boston Police Department, the captain in our precinct, had a meeting with all the Back Bay retailers. At that time, miniatures, which we don't want to use the word nips because we have so many Asian customers right now. So that was a good point that Councilor Flaherty made. What happened was, at the time, the mini bottles were selling for 75 cents. The captain asked us, let's go over $1. So everyone decided to go to $1.25 and take care of their neighborhood and clean up in front of their stores. And if there's a park across the street, they were asked to clean that up. This went extremely well. It was the public-private partnership that can work. Also, during St. Patrick's Day every year for the parade, the city came to us, all the stores in Boston, and asked us not to sell minis. Well, what happened was the worst thing for alcoholism. Everyone went up to the next size, and that was a quarter pint, 100 ml. So what's going to happen here, as a retailer for 45 years, my store is 86 years, but as everyone knows, I'm not that old. What's going to happen here is a 200 ml is going to be the next size up. That's a container that you can't drink in public. So what's going to happen to that container, a 200 ml? It's going to be a big problem. So that's going to increase alcoholism foremost. The answer is a public-private partnership that will work. I'm reaching out because the ban of this nature has proven to generate no measurable impacts on systematic littering or public intoxication, but they would directly harm and potentially ruin small and minority-owned businesses, and there's so many in the city of Boston. These businesses are highly stressed as it is. What works is private-public partnerships between retailers and municipalities, such as what has been accomplished across the state to reduce access to alcohol by minors. Private-public partnerships have also worked to tangibly reduce public intoxication. These successful efforts are ongoing. Another solution that can work with the private-public partnership is the expansion of the state bottle bill. This has been introduced during the 2023 legislative session to include mini bottles of spirits in the bottle bill. 4 bills are available last session. For 3 sessions in a row, MassPAC members in all the stores in Boston have supported expansion of the state bottle bill because it incentivizes citizens to pick up discarded items that can be recycled. This is the best solution to address statewide litter. In fact, $55 million in unclaimed deposits are sitting in the state right now. That money can be used to clean up the parks. We talked about today cleaning up needles, cleaning up miniature bottles. Use some of that money to clean up the parks. Have more barrels. That's the answer and solution, is a joint effort for a cleanup. Meanwhile, a bill would needlessly hurt small businesses that are in competition with neighboring cities and towns, because townspeople will shop for the banned products elsewhere. Look to what happened in Chelsea. Since the ban in Chelsea, revenues at stores plummeted. No, they didn't go out of business, but ask them how bad their sales have been. While the sales increased 63.9% in East Boston, 25.8% in Revere, and 13.8% in Everett. The sales data from the suppliers speaks for itself. All these facts came from suppliers. The truth is that Boston residents and guests will buy minis one city over. Meanwhile, net revenues will go down substantially, making doing business in Boston unprofitable. The hundreds of retailers in Boston help generate over 19,000 Massachusetts jobs, and they are part of an industry that provides over $100 million in excise taxes to the state of Massachusetts. In addition, its local retailers are the contributors to go in-town charities, Little League teams, beautification initiatives. An example is direct support for the Keep America Beautiful program that encourages Massachusetts consumers to properly dispose of their litter. This effort is sponsored by beer, wine, and spirits and retailers across the state, including many of the stores in Boston. Another program sponsored by alcohol retail is the Pick Up Massachusetts campaign. Where are the municipal and state campaigns against litter? We need more campaigns to pick up the litter, and it's a joint effort on all of us. Establishing a Pick Up Boston chapter will serve better to serve the public interest than a product ban, because banning minis has no causational relationship with people discarding lottery tickets, fast food containers, plastic fluid bottles, cigarette butts, needles, and other trash. I pick up more cigarette butts in front of my store than I do miniature bottles. And then we clean up our sidewalks every day. In fact, the Massachusetts Package Store Society Association has supported all the stores to pick up in front of the stores. And if there's a park across the street, we always ask them, being a member of the board of Massachusetts Package Store Association, to clean up the parks or anything in the neighborhood. So this is a joint effort. Again, I strongly be sincere, and I don't want to be a Monday night quarterback, but banning the size, the 50 ml size of miniatures, only will create a 200 ml size. In fact, liquor suppliers in the nation are increasing their supply of 200 ml bottles. So this is going to have a major effect that people are going to drink more. And what are they going to do with a 200 ml bottle? It's going to actually help litter. Maybe they'll throw it out in a container. I strongly suggest we all work on a litter campaign, maybe having a mini bottle, mandatory that it cannot be sold for under $1.50. Most places are 99 cents. That could help, $1.50 miniature bottle. I strongly suggest that, as what we did with the police department 17 years ago when everyone raised their prices. It was a phenomenal effort by the city of Boston and the police. Also, like we talked about the St. Patrick's Day Parade, every year the city asks us not to sell miniatures. Of course, everyone bought the next size up. This year, just didn't finish. This year, we sold less minis than ever. It was phenomenal. And if you did your research, you will find that most of the stores sold less miniatures. Times have changed, people's attitudes have changed, and people are drinking differently. They're actually drinking better products, and the average person that buys the 50 mLs, you don't have to worry about.
Thank you.
Thank you.
And now we'll go with Victoria Gall.
Yes. Good afternoon. I'm Victoria Gall, and I'm a volunteer with Keep Hyde Park Beautiful, a very active community organization which aims to keep Hyde Park a cleaner, greener, and a more beautiful place to live, work, learn, and play. For more than 5 years, the leadership of Kathy Horn, the group founder, we've been focusing on beautification and community greening projects, recycling education, building a sense of community, litter prevention, education, and cleanup. And we've actually have a brochure, do your part to keep Hyde Park beautiful, tips for business owners and managers. Unfortunately, the majority of volunteer time is going to pick up other people's trash. Most of what we collect goes into a landfill because it isn't recyclable or redeemable. We have monthly flash mobs to clean specific locations in Hyde Park, and about a dozen of us regularly clean around our own block. I'm here today to share our experiences with discarded miniature alcohol bottles, which are all over Boston. In 2021 and in 2022, we challenged ourselves to collect 10,000 miniatures that were littering our neighborhood. To show appreciation for our endeavors, a Hyde Park liquor store owner offered 5 cents for each we picked up, and that was $500 for 10,000. I counted them, and I kept them in my garage. We easily did this each time in a few months. It was very shocking to see dozens of plastic bags full of singles put directly into dumpsters. These bottles are too small to be recycled because they clog the machinery. Our efforts definitely raised awareness, but it did not change littering behavior. We find miniatures along the driver's side of roadways like Truman Highway, by parked cars, bus stops, railroad stations, in many liquor store parking lots, caught in street drains, on city benches, and in parks. For those of us who are adventurous, singles can be found by the dozen behind buildings and empty lots, and places, unfortunately, where people go to drink in private. Earlier this year, in just 90 minutes, I drove to 5 locations and picked up 333 singles. I'm going to share with you a few of my favorite places to get nips, and they're not all in Hyde Park. Public benches near a liquor store in Eggleston Square, a liquor store parking lot in Rosendale, parking lot in a bus stop across from a liquor store in Mattapan, and also in Mattapan Square, on the streets and in a playground with benches near a liquor store. In Hyde Park, dozens in the Fairmount, Reedville, and Hyde Park train stations, on the tracks and in parking lots, at the post office park in Hyde Park, and also at Wolcott Square, where there is a liquor store. We are disheartened and are in cleanup fatigue. Keep Hyde Park Beautiful will not have another 10,000 bottle challenge until we see a city and statewide effort to address the littering problem through a combination of education to change behavior, enforcement, especially where you see a sign that says no loitering and no drinking, and through legislation. Banning the sale of miniatures in Boston is an option and should make a difference, but it won't stop the broader littering problem. Keep Hyde Park Beautiful has some suggestions, which we would be happy to discuss at another time. Thank you.
Thank you. And thank you for the public testimony. Now we're going to turn to the second panel. The second panel consists... Okay. All right. So we'll start from left to right. Please introduce yourself, title, and association.
My name is Emily Norton. I'm a city councilor in Newton. Should I give my remarks now or just do the introduction? You're doing
We'll do
the
the
introduction.
introduction first.
My name's Jason Owens. I'm with the Chelsea Navigator Program.
My name's Keith Houghton. I'm the Chief of Police of the Chelsea Police Department.
Roy Avellaneda, former City Council President and Chelsea License Board Commissioner.
Awesome. And we'll start from right to left with presentation and testimony.
Thank you. And I want to thank the Boston City Council Subcommittee for this invite, for the opportunity to discuss Chelsea's experience with the banning of the miniatures. And just to give you some historical reference here, like you, councilors, I was presented at budget to continue to support, at the time, our efforts to deal with the opioid crisis. And we were now in the second year of funding what was the navigator position of Jason Owens. Also, we were paying stipends to our police officers and our firefighters to carry Narcan. And so I wanted to see, as a counselor, as a steward of the finances, what are we getting for the money that was going out? And I was reviewing the numbers of the calls and saying, you know, how is the money being spent and so forth. And the data was coming back of how many calls there were for responses to opiate, how many times a police officer or a firefighter was using Narcan to save a life. And then we were getting the data, and I noticed in the data the numbers, and they had broken it down between responses to opiates and responses to alcoholism. And the number of calls and intakes, it was 8 times the responses for alcohol to Narcan, to opiates rather. And so it begged the question, if we were doing so much at the time, spending so much money on the issue of opiates, yet obviously the problem with what was going on and where our resources were being directed and used was for the alcoholism that was going on in our community, then shouldn't we do something there? And so there began the change, and where, having been a former commissioner on the license board also, having to punish at the time, if you were a bar or you were a restaurant, and you overserved, and at the time, Captain Houghton then, Chief Houghton was then captain, was the delegate to the license board hearing, to the license board. If a bar or restaurant overserved, and you found someone that left that establishment over-intoxicated or served underage, you were punished, you could lose your license, you could be suspended for months at a time. Yet we were doing nothing to the retail liquor establishments that were definitely catering to a segment of our society, our residents, who were being overserved, and we see them everywhere. So thus began the ban, and we implemented first the ban of 50 millimeter bottles, and then we went to the 100. As far as the problem itself, Councilor Flaherty talked about a certain outrage that this shares when they see discarded needles, and we in Chelsea react the same way. I've seen social posts from parents, angry parents who see the needles in the parks, and let me tell you, what does it say about our society when we are just walking by all these bottles, and we're not sharing the similar outrage? As someone who grew up in a minority, poor neighborhood, I will tell you the alcoholism bar is much greater, and those bottles are signs, the same signs as needles. We should be just as outraged at the collection of bottles of minis, same as when we see discarded needles. It's the same thing. Our numbers showed I don't know what the response is here in the city of Boston. But when someone responds to our public services, public safety responds to a call for alcoholism, you have Cataldo ambulance, you have a fire engine with 4 individuals on the truck, and you have a police officer, maybe 2 police officers. That's the resources we throw on a call every time. I have to ask, it begs me, the question was like, we're throwing all the times. As a brother of someone who serves on the fire department, I think about, if they're on this call, what are they not responding to? If a firefighter truck is responding to this sort of call, when the next fire or anything gets called, you have to go out layer. There's a response delay for the next call that could be, God forbid, something much more serious. Is it proper? We know now, we've decided, I think as a society, that we know having a police officer without someone who works as a navigator, such as Jason Owens, respond consistently over and over again. That was always a response of the general public. If there's someone drunk, passed out, just call the cops. But we know that is not the answer. That is not proper use. That's just going to continue to spin. Many of the calls, sometimes the individuals will repeat over and over again. The same individual being taken to a hospital, gets out, the next day is the same call. We know that that's not the way to treat and how to respond to alcoholism. So when we put this ban in, we saw immediate impact. Our first day numbers in 2015, before the ban, we had over 720 alcohol-related calls. Now again, Chelsea is 40,000 people, nothing compared to the 7,000 and such that Boston will have citywide. In 2016, 521. The 200 call, that's almost a 25% reduction. By 2018, it was down to 400. And in the last year before COVID, in 2020, in the last year that, again, I want to clarify, my former city councilor, I keep on saying city council president, no longer, but former, last data I had was 216 calls, down from 720. That's an incredible amount of resources no longer used by public safety officials because we simply banned nips. I will say that we knew the retail stores were catering to the alcoholics. When you're telling me that 25 to 35% of your business is selling minis, not a bottle of wine to go with dinner, not a case of beer to share, on Sunday with watching football with your friends. When 25 to 35% is minis, what does that tell me about your business? Who you're catering to? We had it, yes, Chelsea got cleaner. There was less litter. Immediate overnight success on disappearance of bottles around the city of Chelsea. The only area that continuously, that still today, sometimes still has a collection of bottled and nips is the intersection of Route 16 and Washington Ave. Why? Because that is a major traffic stop, major light for all the commuters of the North Shore that stop in Chelsea. You have people who are coming on their way to work, highly functional alcoholics who are driving to work, need alcohol to get through the day. That's where the collection of nips continues. So sorry, minis continues. The rest of the city has been cleaned up. They've asked, is this an anti-business solution or will it have negative impact to the businesses? I will tell you that in the city of Chelsea, when we first discussed this about implementing this ban, we were thinking about just doing it in the downtown area. We were going to only impact the 4 or 5 retail liquor establishments in the downtown area. But in speaking to the city manager, I convinced them, no, we had to go citywide because it wouldn't be fair to just do downtown. And yet those sales and those other, you give a competitive advantage, our sales, and push those sales, the type of sales we're trying to eliminate, to the outskirts. So we did all of them. Our downtown area transformed once we got rid of the alcoholism effect. Again, we needed to have the outreach to the individuals that were panhandling and hanging around and were disruptive to the other businesses. Once the ban went into place, downtown Broadway is now revitalized. All the other businesses that were suffering from having this negative impact of those individuals hanging around. Again, if you're a family and you want to go to a restaurant, you want to shop, it was a deterrent to have that sort of environment downtown. No one wanted to bring their children when you were seeing these individuals passed out across a city lawn. No one wanted to walk by the restaurant when you have someone panhandling so they can get their fix at the retail liquor store. The restaurant scene is booming. We've had an increase in meal taxes. We've had increase in jobs, and we have less vacancy in our storefronts downtown. So their negative impact did nothing but positive impact to the rest of their neighbors. I had nothing but complaints from neighboring businesses about the individuals that were hanging around, lingering in downtown. So yes, this is a pro-business move if you go forward with this. And despite the sky is falling rhetoric that we heard from our retail liquor establishments, they did not close down. They continued to operate. As a matter of fact, last year, a sale or a transfer of a liquor license for retail sold for 5 times the value pre-COVID. So with the mini ban in place, a liquor license to sell sold for 5 times. So obviously, there's still money to be made in this sort of business, and that it was worth 5 times the value that previous COVID value. Chelsea has specific demographics that many neighborhoods in Boston share, and I'll leave with this. And I know that many of you who represent those areas can identify with the population in Chelsea. But I will tell you that as someone who at once worked 2 jobs between a state house and a real estate office in Back Bay, when I was walking through back and forth Back Bay, I saw the same type of people panhandling, passed out on Comm Ave, panhandling on Boylston Street. This problem is pervasive. It's not just in neighborhoods like Chelsea. It is across all social economic areas. And wherever these retail stores are located, you will see these sort of individuals helping, and they need help. But like the drug war, you cannot just help those victims. You have to go after the perpetrators who are catering specifically to them. You go after the drug dealers and you help those who are drug addicted. And that's how you win this. And that's how I see this. The cleaning of Chelsea is just a side benefit. In reaction, it was the health benefits and the crime reduction that we saw and the economic prosperity that we saw. That was the true reason why we did this. We have, again, I want to introduce Chief Houghton, who was on the license board with us at the time, and Jason Owen, who is a lifesaver who goes out daily to try to save the lives of those who are suffering from alcoholism. Chief.
Good afternoon, members of the Boston City Council and Chair. Thank you for having us. I won't continue what former Councilor Avenida has said, but I did the research back in 2016 through 19, and I was alarmed. The war was on drugs, the war was on opioids, and it was almost 8 times more likely you would be hospitalized in Chelsea on an ambulance run for alcohol-related issues. Where all our resources were going toward the opioid problem, we were missing not only on the illness, which was hidden, the business area was being pretty much destroyed, the Broadway corridor. No one was going down the Broadway corridor of Chelsea. We had a specific clientele. Chelsea is a poor urban community. To me, I consider myself almost like a neighborhood of Boston. We're just across the river, similar in size to Charlestown. The demographics, mostly Latino. We have a huge population from Central America, a lot of them homeless, a lot of them unfortunately addicted to alcohol. And what we saw was the 50 milliliter bottles being purchased continuously. We would place them in protective custody. And for anybody who knows the law, if you are inebriated, the last place as chief of police I want to put you is in a cell in the Chelsea Police Department. I believe it's inhumane. I believe we're just getting to that point now that hospitalization, just like opioid use, has to be used. So these businesses, and we did work with the business as well, speak on later, were catering to their clientele. We actually did ask them to remove the 99-cent bottles, which were the plastic. If you opened them up, I actually had the board sniff them. It smelled like rubbing alcohol. This wasn't the high-end alcohol that was going for $3.99. I guarantee their inventory of the $3.99 alcohol was low. Their 99-cent 50 milliliter bottles, very high. And at that time, they refused. They thought it was, their right to sell anything they wanted. So we did have to address that issue, and we went up to the 100 milliliter later. We track overdose deaths. We didn't track homeless alcohol-related deaths. And we average, for a small city, we still average about possibly four people a day. I know for 3 years in a row, we had 4 homeless alcoholics dying with alcohol on them. 3 last year, down a little. But our call load has gone down significantly. There has to be not just the enforcement, not just the city council coming with a board. You need wraparound services, which we have with, and Jason can speak on that. You need strong enforcement. We have an officer in the back who I brought along, Officer Santiago, who is part of the efforts. We only have a part-time unit. Chelsea's small enough. We basically modeled policy after Boston's, but we've added on to it, including 30-day video surveillance out front, in front. They better clean up their stuff in front because they can't hide. We just ask, I want to see the video 10 days ago because you sold to an intoxicated male. So it really did clean up. In case of the Business Association, we did partner with them. We had a citywide Association meeting, what is probably his predecessor, where we discussed, like, these are the rules, and there is no lack of people standing in line to get a license in Chelsea for liquor stores. I can assure you of that. So what the past councilor did state, it's been like a team effort. Chelsea is unique. I'm not sure if it's unique to all parts of Boston, but alcoholism is unique to all parts of Boston, Chelsea, and everywhere. And the stats speak for themselves. We are down, even with the pandemic, which kind of skews data, we're still down about 20% on our protective custodies from year 2018, about 30% if we went 2 years prior to that. So I just want to say what he said was pretty accurate for the businesses. The Chelsea is rejuvenated. I, as the police chief and a person who lives in the community, would never take my children down that Broadway corridor in 2018 and 17. I do it frequently throughout the city now. So it has made a change in alcohol, and our enforcement, and our education, and our caring for these people was the difference. So thank you.
Good afternoon. My name is Jason Owens. I'm the coordinator for the Navigator program, City of Chelsea. Oh, sorry. All set? All right. So I'm also a resident of the City of Chelsea. I've been an outreach worker in the city for 16 years, for 13 of them with ROCA, and now with the Navigator program for the last 3 years. I guess everything was already said by them. Like, I'm out there every day and I'm encountering all these individuals. So what we do as navigators is we try to connect individuals to services that are suffering from alcoholism, drug addiction, and mental health crisis. We're boots on the ground. We go, we get calls from the police department. We actually have our own call sign and police radio from the city, which is, if you knew anything about my past, is hilarious. But and we have a community van that's offered to us through the city also. We can go out with officers to go out and do this outreach, and the combined effort is just unbelievable. And we've always been supported by the city council and the city managers over there. So we're dealing with a lot of, most of our drunk men are Central American. And we used to have, I'd say about maybe 5 or 6 years ago, probably about a steady 20 of men that were out there. And all of them panhandling, all of them buying little bottles on an hourly basis. You know, they get a quarter here, 5 cents here, 50 cents, $1, and they run right to the liquor store. Sometimes they were running into liquor stores where their pictures were up as a do not sell, and they were still getting them, you know what I mean? And then once that was reported, the city of Chelsea dealt with it immediately. So when we did finally get the ban in the city of Chelsea, I noticed that calls for service, because I'm usually the guy that's calling an ambulance. We get the calls if there's a needle in the community. We respond like the gentleman spoke earlier about 6 to 10 minutes. We don't get like the city of Boston. We just don't get it like that. But we respond, we clean it up. But we try to respond to every overdose, every alcohol crisis, every mental health crisis. And we're a small community, but I noticed those went down significantly. Definitely the litter. I'm also a resident there too, so I've been living in Chelsea for the last 10 years, and I've noticed the transformation of the community. It's absolutely beautiful now, you know what I mean? It still has its rough areas, still has its issues, but we're dealing with the population that is undocumented, so they're limited to their services. They get Mass Health limited. They can go to 3 detoxes in the state of Massachusetts. Say we have 30 available to you, me, anyone else that needs to go. But for these individuals, they only have 3. And if those beds are all chewed up before 8, 9 o'clock in the morning, they're not getting one. So they have another day that they have to wait, and another day that they have to wait. And so we're left with really not a lot to do with these gentlemen. Section 35s, put them in ambulances, send them to the hospital. But we have to constantly, we're on them every day. Sometimes individuals are going to the hospital 3 times a day, one person, at a cost of $500 to $600 a ride. And so we've seen that definitely go down dramatically. We've definitely seen the litter in the trash in the community, the incidents that were happening, and it seems to be working for the city, for us. Whatever you guys do over here is what you're gonna do. You know what I mean? I grew up in the city of Boston my entire life in Charlestown, and so I definitely have a stake in it. I'd like to see good things happen over here, but I've seen what it's done for us. We're on the upswing. We're doing some innovative stuff over there. We're working all together as a combined unit to help these individuals that are in our community, to get them the services that they need. And if someone needs to be held accountable because they're catering to that, just like you would see someone that's selling fentanyl or something else, they have a customer base that they're going to serve. So weren't these liquor stores. They were doing the same exact thing, you know what I mean? Legally, I guess. But it was killing these people just the same. So I like to see that that's getting addressed. And now we have our foot in the gas, and we're only going to go forward with it, and we're not going to go back. And I'm glad to be a part of it. That's pretty much all I got. Thanks for having me here today.
Thank you.
I forgot to mention, Jason was telling me a story. What he didn't mention was that Jason also used to work as a doorman in a Boston establishment bar. And he can talk about the problem nips are for the bars and restaurants in the downtown area. Individuals who are bringing them in, hiding them, and how many the bottles they would find in the bathrooms, which then later on, as a former license board owner, that is a nightmare for a bar. If you're supposed to protect your business and not overserve, yet the individuals are coming into your establishment with hidden alcohol and then get over-inebriated, they come after you, and yet you did everything responsible. So, Jason, if you want to talk about that real quick.
Yeah, real quick. I worked at West End Johnny's. I worked the front door for a while, for 18 months. And we were having a lot of issues in the women's room because they would sneak nips in, and they would down a few of them and flush them down the toilet. So that was causing huge plumbing issues, big money to the establishment and to the owners. So what we started doing is searching everybody coming in, and probably from the floor to where it says Arroyo, we would get a bucket full of nips every Friday and Saturday night. Every Friday and Saturday night. And what we were noticing too is that a lot of college kids come to this place, and they go in and they're only in there, and we just open the line and they're in there for about maybe 45 minutes to an hour and 15 minutes, and they're legless. They're hammered because they're going in the bathroom, they're hitting these mini bottles, and then, to save money and not get a drink, in the establishment, and, they're going out in ambulances, there's fights, we got to try to make sure they get home, but I'm talking the intoxication level was just, and this is from a guy that used to drink around the clock, you know what I mean? I never seen it before with these young kids, so... But it was due to, the nips. And we did that for a while. Little bottles. We did that for a while. It's going to take me a while to get used to that. We did that for a while, and we had, by the end of 4 or 5 months, large trash barrels just filled with these small bottles. It was incredible. I don't know if they're still doing that now. I no longer work there. But for the 18 months that we did do that, we had a huge problem. But it was mostly in the women's room where the issues were. There was a barrel right next to the toilet, too, they could have used, but chose not to.
Thank you so much. Is this on?
There it is. So it'll blink and then it'll start. There you go.
Oh, all right. Okay, great. Again, my name is Emily Norton. I'm a ward counselor, a city counselor in Newton, and I really appreciate the chance to speak with you all today. I commend Councilor Arroyo for your leadership in bringing this item forward. When other cities do stuff, it's like, oh, that's cool. When Boston does something, that's super cool and very influential. On November 16, 2021, the Newton Licensing Commission voted to prohibit the sale of miniature single-use containers for alcoholic beverages in containers less than or equal to 100 milliliters. And it went into effect on June 30th, 2022, and it made Newton at that time the 5th and largest community in Massachusetts to do that. At the time, we actually received very little opposition, and in fact, one of the largest liquor stores in Newton, Marty's in Newtonville, in my ward, expressed his support for the ban, mostly for litter reasons. And since the ban went through, I personally have heard no complaints. I had proposed the ban in August 2021, along with Councilors Allison Leary and Andrea Kelly, out of concern for all the mini bottles that were littering our streets and parks, and also out of an interest in reducing plastic pollution in our environment. To propose something in August and have it get through the Licensing Commission in November was quite fast. It makes me think I would wish more things could be sent to our Licensing Commission. It is not that I or we didn't care about the issues that my colleagues from Chelsea are talking about. We did not have the data. It made common sense to me, and as others have said, you often see them next to intersections, implying that people are drinking and driving. But now, from what I've heard, I'm actually going to go back to our police chief and see if there has been an impact on their level of calls, because we have all of those issues in Newton as well. But the ban on minis was very consistent with other steps that Newton has taken to reduce plastic pollution, particularly banning single-use plastic bags, which I know Boston has done as well. The main argument for us, as I said, was twofold. First, the litter. Nearly every roadside, every park along the Charles River, you see these mini bottles. And it was like, enough, let's put a stop to it. It's not really fair that volunteers have to do all of this work to clean up from some businesses what they're selling and how it's getting dumped. And the second issue that I think is very important is plastic pollution. I'm sure I don't need to tell any of you how ubiquitous plastic is in our environment. It does not fully break down. Microplastics are now found in our bodies, in our bloodstream, in our newborn babies. Plastic pollution is found at the top of Mount Everest, at the depths of the Mariana Trench. It's in over half of sea turtles, 90% of seabirds. And to those who might say, well, this mini bottle ban is not going to address this global problem, I would say you're right. But how do you get from here to there? How do we get to a world with less plastic in it if we take this problem seriously? You start with the easy stuff: single-use plastic bags, single-use plastic bottles, mini bottles, and that's, to me, what this is doing. It's saying, let's start with the easy stuff and take it from there. After Boston, then other communities, and then ideally the whole state will say no more plastic bags, no more mini bottles, and onward. And to the suggestion that the bottle bill, like, if we're gonna wait for the state legislature, like, forget it. I won't say anything more about that. To those who say that this is just stupid, and I know that has been, I've seen that on social media, that's fine. I would just say I don't agree. I think it matters. Reducing plastic pollution is a vital environmental justice issue. The usual plastic for minis is PET number 1, which is a toxic synthetic petrochemical, and plastic manufacturing plants are disproportionately located near environmental justice communities in Texas and Louisiana. The production of plastic pollutes the air, water, and soil along every step of its production, and then again when it's discarded in landfills or burned in incinerators. While we all suffer the impacts to some extent, disproportionately the victims of this poisoned air, water, and land are brown and black people here in the United States and around the world. And as fossil fuel companies see the writing on the wall for oil and gas, they are looking to the growth in the plastics industry to keep their profits flowing. That will be more poisoning of air, water, and land for marginalized people all around the world. Just one example, Formosa Plastics had planned to build a $9.4 billion facility in Louisiana's St. James Parish between New Orleans and Baton Rouge in an area known colloquially as Cancer Alley. 87% of the residents are black. The construction not only threatens the health of residents, but this particular project would also desecrate the burial site of enslaved African Americans. Residents organized and rose up, and now the project is on hold, hopefully forever. Right here in Massachusetts, the Wheelabrator incinerator in Saugus is taking other communities' trash, including Newton's, over 400,000 tons of trash every year, burning it, burying 100,000 tons of ash in an unlined landfill, thereby poisoning the water and air of the EJ communities of Saugus, Revere, and Lynn. So the more that we can be cutting off this toxic material at the source by not using it in the first place, the better for everyone, especially EJ communities. So I urge Boston to take this step, follow the lead of your neighbors in Chelsea and Newton and Brookline, and ban the sale of miniatures. Thank you.
I want to thank the panel for the testimony and mind-blowing data. They didn't even think that through on banning these miniature bottles. I had one question, or two questions, and what we hear a lot of pushback from is, stores closing, loss of sales. How many liquor stores have actually closed during or after the ban?
No one. They're all still open and viable. As a matter of fact, as I stated, one of the transfers of the liquor license just sold for almost $600,000, and for Chelsea, that's an astronomical number. So their viability is still very strong.
And I see all the positive impacts this ban has created. Just my last question is, why the ban and not like a larger tax on the miniature bottles? Why go to banning it as opposed to, maybe increasing like a higher tax?
Well, again, I don't know what authority a municipality like Chelsea has to put on its own separate home rule petition to tax on a bottle of that nature. But it just seemed that the ban in itself was going to be the best way to handle the issue. We were legally empowered to do it. And we didn't have to wait for the state legislature to have to pass a home rule petition, because any sort of tax like that would have to get passed. And let's face it, there is just too much power, I think, by the industry that would have allowed even a little town like Chelsea to pass a home rule petition like that. So we had the power to ban it, and it has worked successfully.
And I'll just add that they were catering to the clientele, as we said. It was like feeding a substance abuse problem. It did come up in one of the early licensing commissions, just get rid of the 99-cent high-octane alcohol and go with your higher-end bottles, and the businesses refused. And that was basically, we did our own research on the police department. They did not have high-end alcohol on them when they were hospitalized. It was the easy 99 cents plastic miniature bottles, and that's why we actually went up to the 50 milliliter to 100. And I can add, we are up to the pint level now, right? A half pint is the minimum level you can buy. Much harder to hide. He's a navigator. He's out there. They do try to, buy it and share it. We don't find many of those bottles, and it's so much easier to see them out in the street in the parks for enforcement.
Awesome. Oh, great work. A lot of positive impacts, and the data definitely shows it. So thank you for joining us here today, and I'll pass it off to the sponsor, Councilor Arroyo.
Well, I want to thank all of you for taking the time to do this, but also for doing this. Frankly, this was first brought to my attention by former Councilor Avellaneda, and I remember thinking like, oh, that's an interesting idea. If the data shows out, that's pretty interesting. Then Newton did it, and then I got sort of prompted again, hey, we should probably look at whether or not the city of Boston should do that. And then that sort of happened at the same time as Keep Hyde Park Beautiful getting sort of publicity on the local issue to my district. But it also occurred sort of in this window of, the sort of cascading ripple impact of this, right? For some people, this is simply a nuisance that they see on the street when they're walking their dogs or going to the park, and it doesn't take up that much of their time in their brain when they think about it beyond just saying, I wish that was in a trash can or I wish that wasn't there. But for other people, I have heard since I presented this, I've received phone calls from people saying, hey, as a recovering alcoholic, I can tell you that the issue with singles was that they largely, when you're consuming them regularly, it's often because you're aware or becoming aware that you have a problem with alcoholism, but you're trying to sort of convince yourself that you're showing moderation by purchasing smaller amounts, and then you're actually drinking more. And that was a common thing. I got enough phone calls on that to know that that's a real experience. I had somebody else who said, hey, I'm in AA, and you hear about miniatures in AA. Like, people will talk about them when they're in Alcoholics Anonymous, about the impact that it's had on their lives, and sort of as a red flag. I can tell you, I was very public about the impact alcoholism had in my own family. And I remember that stage, actually, the hiding miniatures. And I think one of the things about miniatures that sort of is common sense when you think about it, but that much of the appeal is that they're easily hidden. It's not that they're necessarily cheap. It's not that they're necessarily a smaller amount, but that they're easier to actually conceal and bring into bars, restaurants, stadium establishments, schools, drink on the street but not have them viewable when police are looking for folks who are openly drinking, to do public intoxication, to drink and drive, because it's easier to hide that than it is to hide some other open container. And I think that concealment, which was not a part of my analysis when I was looking at this, I was looking at it from medical sort of emergencies. I was looking at it from what's the impact on our communities from a public good standpoint. I did not think about their appeal being the fact that you can sort of hide them until I saw sort of on social media and sort of publicly when people discussed why they still wanted them, the excuse or the reason was always, oh, I use these to sneak into a movie theater, or I use these to sneak into Fenway, or I use these to sneak into TD Garden. Don't take this thing because I use it. Sometimes I'll use it when I'm at work and I'm trying to put it in my coffee or whatever it is. And so I think the concealment aspect of it was not a part of this, but I think the concealment aspect shows sort of the ability to misuse this little bottle, to basically essentially use it to, in the furtherance of, in some cases, actual crimes like drinking and driving, which, you know, until I got those phone calls, until I saw that stuff, I just assumed that people were walking down the street throwing these into roadways. And I realized how dumb that was, frankly, that it was essentially that this was folks just throwing them out of the car when they passed that parkway. Because, you know, I would say, how are we picking these up? I would volunteer with Keep Hyde Park Beautiful, and we have Truman Parkway in my district, which is state land. It's right by the Stony Brook Reservation, and there's no sidewalks. And yet you're collecting hundreds of these things off the side of the street, and it's like, well, this is wild. I've lived here my entire life. I've never seen anybody really walking down this stretch of land. And so I think that the connection to drinking and driving with this particular size of a bottle, I would be really interested in. I don't think that's something that we keep numbers on, but I think that's a sort of alternative use that these come in with, which is that people use them because they're easily hidden. I will just touch on the business thing, because I have an issue with, like, sort of when things aren't very logical to me. And so one of the things that I've heard repeatedly from the business side of it is, well, don't ban that because then they're just going to buy the bigger alcohol. Well, if they're buying the bigger alcohol, then there's no issue with your bottom line. You're making more money on the bigger alcohol. So if they're saying, hey, that same person will no longer buy a single for 99 cents, they're just going to buy a $5 or $3 bottle. If that is true, then you're actually going to profit from that ban. So to argue that you're going to lose money because folks aren't going to buy singles anymore, they'll just buy bigger bottles, to me is a fallacy. It means you should probably support it, not be opposed to it. And I would say that what actually is borne out by the data that I'm hearing from Chelsea is that people didn't go and buy larger amounts of alcohol and then go throw those larger bottles on the street. It actually did stop that littering to some degree, or entirely, except for that one intersection. And it did have a noticeable impact on the emergency medical calls for alcohol. Is that accurate?
That's accurate. Very accurate.
And so when I look at your numbers in Chelsea, which are the only ones that I think, because Newton doesn't have them yet, what I have heard from Newton, and I guess you can let me know if this is true, what I've heard is that there's a noticeable impact on what you can see, that the litter problem has been impacted in the short time that you've had this.
Yeah, when I blame it on Waltham.
But how noticeable was that impact? Was it a significant impact in terms of what you're seeing on the streets on a day-to-day basis?
They're not all gone. I mean, people obviously can still buy them elsewhere, so I don't want to overstate it, and it's also still relatively new. I think we're going to see more. We have Newton Serves coming up and Earth Day coming up when we do our cleanup, so I think we will get some data then on what it was like compared to past years.
And in Chelsea, what was the difference? You've had it longer. You've had it almost
immediate.
7 years now.
I can tell you right now, as the chief of police, I've been the chief police officer for 37 years, the chief for the last 6 months. When someone sees a small bottle in front of their house, they panic. They think the liquor stores are selling them again, and I have to tell them to come back off the cliff. And it's usually at bus stops, busy intersections where you know they threw them out the window. In fact, my fellow former counselor, he actually sent me a picture of one, where if you saw the pictures that he possibly has in his presentation, hundreds and hundreds everywhere through the downtown area. It was immediate, and like I said, randomly I'll get a call, a complaint, and it's always about, are they selling it again? And we do a quick response with our team to go just to do an inspection, an announced inspection. And all the liquor stores, I will have to say, have really came on board in Chelsea. We have no adversarial relationship with any of them.
I'm assuming, though, and you were on the licensing board, I'm assuming when they appealed this decision to the licensing board, there was some adversarial, and then since then, yeah.
Well, it's interesting because we did it in two steps. First we did the 50 millimeters, and then we did the 100. Apparently, even though the license board commissioners sent the letter to all of the retail liquor establishments that we were banning the 50 millimeters, that no one showed up to the hearing because I don't think anyone bothered to read the letter from the license board commissioners that we were doing this. So we banned it. Now all of a sudden, when it went into effect, is when they showed up. Once it was already in effect, they showed up. It was like, what are you doing banning the 50s? And then we said, oh, wait a minute. We're going to do the 100s now next. And yes, they appealed it. But the ABCC ruled, again, that we had the authority and allowed it. But again, since then, and it's interesting that I sometimes get contacted by residents who will say, you know, I didn't realize how much cleaner Chelsea is until I went next door. I went to this other city and I'm seeing the nips again. And then I realized, Mike, oh yeah, we don't have them anymore because you just don't see them in the streets anymore. I mean, again, it was immediate.
And so I have a question for you on the licensing side of this, because I believe, Newton, you also did it through your licensing board as well, right? And you did it through your licensing board. Were you on the licensing board at the time?
No, I was not. I was a city councilor pushing for it at the time.
And so the licensing board rules and regulations are statewide, correct? So like when the Massachusetts Alcohol Commission comes back with something, so like in Chelsea's case, where they came and they validated that you have the ability to create a regulation, that it's not a modification, then Newton can use that same ruling, Boston can use that same ruling, just like any kind of criminal case law, it creates the precedent for the rest of the state. Is that accurate? Is that an accurate understanding?
Correct. Every city and town has its own rules and regulations for licensing. The license board regulating taxis, the gold shops, retail restaurants, and retail liquor stores. We have our own rules and regulations, and they may differ from one city to another. And as long as they do not conflict with Mass General Law or any CMR, then we're fine. But we basically are free to run our hours of operation of any establishment. If Boston wanted to say, you can open up a bar 24 hours, or you are now allowed to open till 4 a.m., that is a Boston regulation. It's not something the ABCC or the state can prohibit you to. What stops a bar from opening 24 hours isn't the state, it's the local licensing authority. So you are well within your power to a local licensing board to set up whatever rules it wants to how businesses should operate.
And so I am an attorney, and I looked into sort of the legal ramifications of this, and it seems like when this was done in Chelsea, there was an appeal to the Massachusetts Alcohol Commission. That appeal came back favorably. Essentially, what it found was that this doesn't count as a modification of their license. It's simply a city regulation, just like what you were listing, where we can regulate time and place. And so, obviously, that holds up. The legal opening that anybody would have to challenge this is on whether or not it's a quote-unquote reasonable regulation. Obviously, I think it's a reasonable regulation. I would just ask Chief Holden, you were asked about the impact this had in Chelsea. You called it a game changer. When you called it a game changer, what was that in reference to for Chelsea?
Well, it transformed many things. Like, as the police department, litter was probably low on our end, but litter is a sign of significant other things. It was just because I was doing the data as being the representative for former Chief Kais at the Licensing Commission, just the alcohol runs, the money that it was costing the taxpayer for fire, police, EMS to respond continuously, the deterioration of the downtown corridor. It changed almost overnight. It really did. And we had a few liquor stores try to be sneaky. I told you off record there that we seized 4,000 1,500 milliliter small bottles from them. It's just amazing. And a person like Jason who does the wraparound services, the alcohol was it was noticeable, but unnoticed by the people who should have been taking enforcement health actions and things of that nature. So that was the game changer. It was almost really overnight that it changed.
Might I just say,
Yeah, you can both add something. Just pick whichever order you want to do it in.
It's me. So I started working in Chelsea in 2007, and I worked for an organization called Roca. So my first job in the city of Chelsea was to run a work crew. So I cleaned 13 parks and 5 random streets a day. And on a Monday morning, they used to have to dedicate a trash truck to follow our van around because of the empties in the little bottles and all the stuff that we were picking up in the parks. It was staggering. And I never really thought about it until someone on this panel said, the city was sicker then. It really was. We had a lot of violence. We had a lot of gang stuff. We had a lot of shootings. We had some homicides happening. It was really, really bad in the beginning when I first started there. Fast forward now with the stuff that we're doing, working together, not fighting amongst each other about this, that, and the other thing. It's been transformed. It really, really has. And like I said, I live there now. Like I could have bought a place anywhere. I bought there because I can see it's getting better. And because of brave moves that are happening by city council, police department, and allowing us to actually do our work. But I remember how bad it was before any of this stuff was happening, when everyone was stepping back and hiding in their silos and not working together with each other. It was really rough, but to see it now is great.
to follow up 2 things. One, I have to think that, I think this hopscotch approach that the city of Boston is doing now, where some don't sell minis and some do, you actually may be in legal jeopardy because those ones who are prohibited, even though they approve, are saying, wait a minute, you are discriminating my business practice. How come they got to do it, not me? We did it one and all. So it'd be interesting because someone could have a case to say you are indiscriminately doing one, like for hours. In a ABCC decision, if we tell a one restaurant, you are only allowed to open till 12 p.m. or 12 a.m., and then the others are all to 1 a.m. Whenever we made that decision based on poor business practice, they appeal, and they are more likely to win an appeal because we're not doing it for all. ABCC wants a uniform policy for all. So this hopscotch actually may be more dangerous and more likely to have a legal challenge than anything else. About what Jason was saying, when we talk about policing and your predecessor, Police Chief Kais, now U.S. Marshal, we talk very commonly about police approach, and they talk about the broken window effect in neighborhoods. Once you saw the broken window and then other things, bad things happened to Jason, I would say the alcoholism, everyone's seeing, we live in an urban landscape, the drunk individual passed out or panhandling, it's so ubiquitous in so many neighborhoods. That is the broken window. When you start allowing those type of individuals just to be untreated and pervasive in neighborhoods, other individuals think it's open shop for other types of crimes. It leads to a downfall for a community. If you see those bottles and alcoholism, they're saying, okay, this city and this area is downtrodden. I can set up shop because they think that that's what's allowable. You put that individual, I would say, that sort of individual that's standing in the middle of Bellingham Square, and you put him in the middle of Wellesley, he stands out. It wouldn't pass. And they'll say, well, yeah, we allowed that to happen. We kept on walking by this individual, driving by this individual. It's Chelsea. And then finally we said, no, you know what, we need to address this. And that was the lowest hanging fruit. And once we took care of them or addressed that issue, the other items started to disappear.
So I have a question for Jason. Were you doing this work pre-ban? Pre-banning of the NIFs in Chelsea? Or miniatures, rather?
Yeah, so I was involved in the hub and core at the time. So yeah, when I tell you outreach, I've been doing outreach for 16 years in the city of Chelsea.
So here's my question for you. As somebody who's talking directly to people who were in the thralls of alcohol addiction, what impact did banning singles and miniatures in Chelsea have on those individuals and their interactions with you and sort of how that worked through? Was there a noticeable difference when they no longer had access to miniatures and singles?
So yes, so we were able to get more people in treatment, some of them in long-term treatment, than before. But alcoholism is a crazy disease, and people are going to find ways to get what they need to get. There were other individuals that took their business elsewhere and went to East Boston, like alcoholic men that went and just set up shop in parks over in Eastie because they couldn't get what they needed in Chelsea. And I was glad to show them where the Meridian Street Bridge was to get there. But it's tough. But there's a gentleman that I've known since I was 17 years old, back when I was having my issues, and I was in Deer Island, and he was there also for being a drunken maniac in his community. He is now sober, about maybe 6 months, and he's in his 60s, and he's living in the Y, and he's got a year free rent, and he was an individual we started being able to have the conversations with about getting sober after this ban had happened. And now he's actually there, and I thought I would never see it in a million years. He's actually one of my favorite guys in the community, but he's doing it now, and he's sober. And we have other issues and other stories, success stories that have come out of that, you know what I mean? But we're also dealing with the opiates and the crack and the mental health crisis. We're dealing with all that. But the alcohol is a big issue,
But
issue.
in your personal opinion, was the banning of the sale of these miniatures and singles directly responsible in some cases to better health outcomes for these individuals?
Better health outcomes for the individuals and the city as a whole.
Yeah, and I'll just end, and I appreciate the chair for the allowance of time, but I'll just end by saying, that was a powerful statement to me. The fact that we see these syringes and they do cause visible angst when you see them. But, one of those things when you see hundreds and thousands of these things all over the city of Boston, now I can't stop seeing them. Now I see them everywhere I go. Yeah. But it's one of those things. But when you see them, they never really created for me the same sort of oh, that's an indicator of a problem. It was more, that's an indicator of litter, that's an indicator of this. But now that I can sort of get all of the information that I've gotten about people drinking and driving with them, people going to parks and places where they're trying to conceal them, I think one of the major things I've learned about miniatures and singles is that they're not purchased to go back home. Mm-mm. They're purchased to dispose of discreetly on a street or in a private establishment, or perhaps somebody brings it to a trash can, but the vast majority of these are purchased for the sake of not bringing them home, right? You bring home a bottle of wine, you bring home something else, it's more of an indication that when you are regularly purchasing these, you're actually regularly purchasing these. The disposal on the street or the disposal not at home is the point. Mm-hmm. And so I think that's something that we should reflect on sort of societally about what we sort of allow to be sold regularly. And I'll just say for myself, I am in full support of this. I obviously presented this. I think it's clear to me that the boards have the ability to regulate based on public health and safety. I had this line of questioning where I asked, is there any difference in public health and safety from neighborhood to neighborhood? I think there was some attempt to parse the differences between, say, Beacon Hill and, say, Hyde Park. I don't believe that there's any difference in alcoholism and where it is. In fact, I think the numbers that we got for the medical emergencies in that very short amount of time included Beacon Hill, South End, Back Bay. You go look at property values, those property values are extensive. Those are some of the more elaborately wealthy parts of Boston. And so this is clearly an overarching issue. And so what I mean to say, and what I will just put on the record here is, if the board is saying to an individual store, hey, you're in Hyde Park, and we've heard from Hyde Park residents that this is a public health issue and there's a pollution issue, that next store in Dorchester or in South Boston doesn't have any less issue when it comes to pollution or to public health or to public good. It's the same communities, it is the same drivers. I have a hard time with how we can create a distinction as a city between, this corner here, this one's bad, but that corner over there, that one's good, based on the fact that people don't, I will say this, most of our, as Kathy pointed out from Keep Hyde Park Beautiful, most of our liquor stores are not doing a great job of keeping these out of their parking lot. I think there's a problem when you're seeing open and used containers in a parking lot and what that indication of what that is actually used for. You're using it before you get into a car. But I think the reality is that there's no way for any one individual liquor store or package store to control where somebody throws away that bottle once they leave the store. And so this idea that you can sort of control that issue piecemeal, to me, doesn't make a lot of sense. Just like I don't think you control alcoholism piecemeal. And I'll just end with saying that this is not going to solve alcoholism. Alcoholism is a long-standing issue. It's for life. People who have it struggle with controlling it within years of use. I was a public defender at CPCS. I had people who were both coming in and out of contact with the law on alcohol abuse just as much as I had people coming in for opiate abuse. And the reality is it's a lifelong struggle for most people. I don't think that the point here is that we're going to stop people from having access to alcohol or that we're going to stop their impulses or urges for alcohol. But I do think we should facilitate good legislation that makes it harder for bad things to happen. I think that's our call. And so I recognize for some who have reached out to me that there's a profit margin focus and motivation. I'm not belittling that. I recognize that for some people, they see this as sort of a nuisance for our time to talk about this, but I think it's actually very clear that this is a significant issue to bring before the city. What I would say is I, as a legislator, have always believed and understood that our job is to legislate for the public good. You can't stop, for instance, every firearm from being used irresponsibly or responsibly, but that doesn't stop us from attempting to regulate that as well. And I think when we have impacts like this where it's clear that in the pro column, it's way up here. I'm hearing a lot of good, great reasons to come here. On this side, I've heard profit margin. That's literally it. I haven't even heard we'll go out of business. I've just heard my profit margin is going to get hurt. That's a very unbalanced scale for me. And when I'm tasked with doing public good work, I take into account what that impact will be on individual businesses clearly. But I never even stop to think about, and I'll seed it over after this, what you said, which is that businesses and restaurants and other businesses actually benefited from this legislation. It was a pro-business legislation in Chelsea. It's been done in 5 different communities in the state. It's high time that Boston add itself to the list, especially since it appears to me that we have a de facto policy of essentially asking new transfers and new businesses to do this. It should be across the board. It should not be piecemeal. We should not be creating uneven standards in the city of Boston. And so I obviously support this. I thank all of you for championing this and for having the insight and the wherewithal to do this. I personally would not have known about this or known to do this had I not seen what you were able to do in your cities and the data and the work that you did. So thank you to Chelsea, thank you to Newton, and thank you to the 3 other places, Wareham, Falmouth, and I'm going to forget the last one, so sorry to them. They can email me furiously. Wareham, for doing this. So thank you.
Council, I might add one thing as you were speaking. This is one thing I did bring up at the Licensing Commission. The 50 and 100 milliliters are traveling bottles. You don't go to someone's house unless it's a holiday that someone serves you a 50 or 100 milliliter. Because I had arguments with my friends. They don't understand. I go, when do you go to a household that they serve you that? During the holidays, you may get a gift basket. Mm-hmm. It is specifically a mobile vessel for alcohol. And that's an important part why you see the litter. So I did have that in my notes, and I wanted to say that. That's the prime reason for the bottle and the size of it. So thank you.
Thank you.
Thank you. Now we'll go to Councilor Lara.
Thank you, Chair. I have no further questions. I just wanted to extend my thanks. All of the questions that I have been answered today. I mostly wanted to really gather information about the impact based on the concerns that I've heard from my constituents and that we've received in our email. During her public testimony, Kathy mentioned Eggleston Square, and that is not only in my district, but it's the neighborhood that I grew up in. And we have a public park, a very small kind of pocket park in Eggleston Square. And that is the place where you see people in the neighborhood, they'll walk to the liquor store, they'll get the miniature bottles, they'll go sit down there and they collect and they collect. I go as much as I can to pick up trash in the neighborhood, and so I see them often. And it's really encouraging to hear about the positive impact that this could have on the city of Boston if we move forward with it. And it's just not lost on me that there are certain communities who are impacted by this in a different way, right? When you think about Black and brown communities, working class communities, immigrant communities, because of all of the other structural issues and all the other struggles that we see them more in certain neighborhoods, and our people and our small businesses who are struggling, right? They kind of have to pay the price for littered streets, for folks who are drunk or struggling with alcoholism and so on and so forth, in addition to the resources that we have to spend as a city. So, you know, I think I agree with Councilor Arroyo that it can only do good in this sense. And I think that we find ourselves having the conversation about how much profit or gain is a life worth, or how much profit and gain can we say no to in order to, you know, increase and benefit public health and so on and so forth. And like Councilor Arroyo said, we definitely want to balance those two out, but there is a very clear difference and a very clear, for me at least, hierarchy in what we are prioritizing. So thank you for all the information that you've given us today, and I hope that this informs not only my council colleagues, but the people in the city about how we move forward with this.
Thank you.
Thank you. Thank you, Councilor Lara, and thank you to the panel again. As I said earlier, this policy, you know, the benefits definitely outweigh the cons, and just hearing from Newton and Chelsea the positive impacts and how this leads to even more impacts, hopefully as more cities adopt it, is our step into creating a healthier and increasing the quality of life throughout our country. So thank you so much for joining us, and thank you for all the work that you guys have done. Thank you.
Thank you all.
Thank you. And now we're going to go to public testimony. We're going to go back and forth from in-person to online. So we'll start with online testimony with Joseph Giano. Might have said Joseph. It's like break it out. Yeah, I saw that. Because I got tired. I need to do that. Could you send me I would never have got it. How we can't listen. Yeah, I would never. I didn't know it was on my council. All right. In the meantime, we'll start with in person. We'll go with Joe Santiago.
No, he's.
Oh, he's gone. Okay. We'll go with Chris D'Amatos. No, she doesn't want to do it. Just call her.
I just sent you an updated list. Joe isn't here.
Okay.
So I just sent you an updated list. Can you read it?
Yeah, I'll take a look at it.
Oh, you got these two too.
Perfect.
Francisco Starling.
Yeah.
This is me, so ignore that. That's
Okay,
me.
got it. All right. Please state your name and any affiliations.
Chris D'Amatos, Crown Liquors in Dorchester.
Give us 1 minute.
Okay.
Turn on the mic. Yep, go ahead.
Start?
Yep.
Chris D'Amatos, Crown's Liquors in Dorchester, Mass. Recently, as you know, you guys approved a total wine superstore to open up in South Bay, which affected local liquor stores like ours in Dorchester, Roxbury, South Boston, and so on. And now you guys are bringing forward another regulation that you're trying to pass ordinance here to remove not only NIPS, but also 100 mils. I think this will affect the community surrounding, the people that we service in our area are coming, you know, it's not a big percentage of sales, but it's enough that the people that we service are looking for that particular size. And that's what they can afford, that's what they want to buy. To make them buy now a quarter, you know, half a pint or pint, or I don't see that making any more sense. And as to the litter and the stuff like that, that's the responsibility of each, you know, business owner to make sure in front of his business it is clean, the neighbor's house next door, parks, whatever have you. And that's, you know, that's it.
Thank you.
Okay.
Now we'll go to Martha M. on Zoom. As we're getting Martha M. queued up, we'll go with Christina Rosa, if she's in it.
Christian Rosa.
Oh, Christian, sorry.
They both work, either one.
Yep.
All set?
Yep, state your name and your affiliation.
Christian Rosa, Rosa's Liquors in Dorchester. So good afternoon. Thank you for the opportunity for me to testify today. My name is Christian Rosa. As I said, I am a Bostonian born and raised in Dorchester, where is my business. Rosa's Liquors, also located in Dorchester. We are a small mom and pop, in this case, mom and son minority owned business, which has served the community we live in for over 27 years. My mom and myself, as well as other family members, along with our staff and their family members, depend on a business to survive, which will be affected by the loss of small bottle sales if this were to pass. The ban would also open up the doors to illegal sales from purchases in surrounding cities, like we've seen with Newport menthol cigarettes, which are now easy to get on the street and nobody's checking IDs, which puts our kids at risk. Also, it would limit the affordable options for our customers who are already struggling. Also keeping in mind those who are fighting alcohol addiction, being forced to buy bigger and drink more. Furthermore, the ban would contribute to gentrification, modern-day redlining, and displacement. Small businesses, particularly those owned by people of color, are already facing challenges in remaining in our neighborhoods due to the rising prices of rent and property values. The ban would further exacerbate this issue by limiting the revenue streams of the businesses, potentially pushing them out of the communities that we also live in. Instead of pushing small business owners, the city should work, and I would love to help, with addressing the root causes of the issues they are attempting to solve with this ban. This would include alcohol addiction, supporting additional recovery programs, because customers who are obligated to buy bigger bottles if the ban would go into effect. Investing in affordable housing and protecting small businesses from the negative impacts of this action. In conclusion, banning miniature bottles would not only harm small businesses and their owners, but also contribute to the wider social issues such as gentrification and displacement. It is essential to find alternative solutions that do not disappropriately impact our communities and small business owners. Thank you for your time.
Thank you. And we'll next have Carlos Castillo.
Thank you, Councilor Arroyo. Carlos Castillo, Roxbury, Mass., Dearborn Wine. I know a lot of you guys, personally over the years and the work we do in the neighborhood. And I know that you guys are open to hearing both sides. My only concern here today was that we heard from 7 or 8 experts showing one side, supporting one side. Only one person spoke on behalf of the Massachusetts Association of Package Stores, who I haven't met yet. And so when I think about transparency and making a decision that's going to reflect our city, and Chelsea is 17 times smaller than Boston, 40,000 people. Newton is about 7 times smaller than Boston, with an area median income of over 150,000. When we go over the changes and the things that are happening in Chelsea, kind of reminds me of old Jamaica Plain and new Jamaica Plain. I think there's a lot that we can do to work together if both sides work together. And what I'm seeing here today is that only, 7 or 8 people spoke on the other side. We're here listening to it. We just found out about this Friday night. And we found out casually because I happened to be out at a restaurant when somebody said, hey, this hearing is today. I've had no conversations aside from over the weekend. I think with you, Brian, I haven't had a chance to talk to Councilor Arroyo. I think our councilors, including Flaherty, everybody here, Kendra Lauder, who just stepped out, are all brilliant and a good reflection of our communities, but we need to hear both sides. We need to come to a middle ground. And Chelsea's no reflection of Boston. We lost the sale of menthol cigarettes a few years ago. The state compensated that revenue with legalizing cannabis. We just lost it. We lost 80% of cigarette sales just to that. Is alcoholism a problem? I completely agree. Are we going to solve it with this, just like Councilor Arroyo said? No. How is this going to impact us? What was clear today in today's meeting is that there's a lack of data even from Executive Director Kathleen Joyce, and even from the folks in Newton. They don't have all the data. We heard from, I don't know if he's a counselor from Chelsea, that he said that they got 8 times more calls for alcohol-related issues than they did narcotics, right? But we don't know if those 8 calls more were related to sales of miniature bottles or quarter pints, or from the amount of bars that are in Chelsea, or from the amount of people that are really dealing with alcoholism in all the bars around Chelsea. I work mostly in Roxbury. You could probably count on one hand how many bars are open that sell alcohol. Maybe it's 2 or 3, but in Chelsea, they're on every block. The point is that they're not necessarily a reflection of our city. We don't have menthol cigarettes. We might lose this. Kathleen mentioned that sometimes it's 30% of inventory, which could be 30% of sales, which if we look at quick numbers that we're scrambling to put together to give you data from the other side, because a lot of people don't have it, that might mean 3 or 4 employees per store that we have to cut back on so that we can make the numbers work. That means in a city like Boston, if you have 200 or 250 or so liquor licenses, liquor establishments, liquor stores, package stores, that could be over 1,000 people losing their jobs, and we're just small stores, right? And so we got to look at whether, okay, are we willing to sacrifice that 1,000 and those families for a greater good? Because Councilor Arroyo said, look, I'm getting this much information about the negative and it comes down to profit, but I'm getting all this about the positives. And I don't think it's necessarily scaled that way because we haven't worked together to figure out a happy medium. Are stores being asked to not carry these when they're being transferred? They are. Is there a financial impact on? It is. We've seen those sales drop 30 or 40% of the value of that store. In Chelsea, what they didn't tell us was that a lot of store owners have sold because they can no longer make their numbers work. It's one thing when we're right now in the environment that we're in with rising rates, with rising wages, with rising everything to try and keep the lights on. It's no longer the business that it was years ago. Am I going to be fine? Are people going to be fine? Yeah. Are the people that are going to be laid off fine? Perhaps they'll find other jobs, but we're not going in that direction. And a lot of the beautiful things that they said about Chelsea do tie into gentrification. Now they're buying stuff in downtown. Now they have different kinds of restaurants. Chelsea is changing, and it's not changing to look like us. It's changing to look very different. And so we need to look at it from every angle to see how we can work together, because we rely on our counselors to support the small business community. Right now, we're only hearing one side. And that's why you have all this data and the positives and only people saying it's profit. But what are they doing with that profit? Is that employing people? Where's that profit going? It's not going to a brand new Mercedes necessarily. If you take that away, how does it impact it? Will people buy the next size up? We don't know. We don't know. People are going to buy whatever they want to buy, right? But right now I can tell you from one of our stores, it's almost 30% of sales, and it will cost us 3 to 4 employees. So in closing, I'm hoping that we can have a further discussion and maybe meet somewhere, a middle ground, if it's not a done deal. Because as I sat here, I almost felt like, he's set on it, but I know him to be open to hearing all sides. So we've been here 3 hours. I don't want to take up more time and keep everybody here a little bit longer. I'm hoping that there's a continuing conversation that's going to take into account the effect that it'll have, and that we can collect data, which we learned today is non-existent. Thank you for your time.
Thank you. And as the next 2 public testimony come down, I want to have Councilor Arroyo say a few words, but we're going to have Francisco Fernandez and Starlene Fernandez up next.
Thank you, Mr. Chair. Are we there? All right, thank you, Mr. Chair. I'm also grateful to our business community for taking the time to be here. Obviously, this is an impactful, important issue for you. So I want to be clear, because I don't see most of you in here for other council issues. That's not a criticism, that's just this process is a little different. The reason that there's less of a focus on what you're speaking to about timing and all of that is because this isn't an issue that eventually will get made here. So generally speaking, when we do something in the city council, it comes before the city council as a vote in some way, shape, or form. There's an ordinance or a home rule petition to the state. This is essentially going to have to go through the licensing board, and the licensing board, if they decide to do this, will be required to have listening sessions with you all specifically, and only really you. And so there's a separate process to this, where today is, generally speaking, about figuring out what the city already does So I didn't realize that they had a blanket sort of every transfer. And then seeing where they can go and what the medical data shows. I would say there is data. It's not as broken down as I would like it to be, but there's plenty of data that we have. It's just a question of getting it all the way around. As this moves forward, there will be further conversations and chances for folks in the business community to speak directly to the impact that they believe this will have on them, or that they can show through data or whatever it is that it would have on them. This right here is to make sure that we're building that conversation about, is this even worth exploring? And then once we get to a further step, unlike most council things, which would go to an ordinance or a home rule petition that would go through the city council, and then that process would be on us, this process would transfer over to the license commission and the licensing board, and they would sort of pick up that. So everybody would be notified. Everybody would have a chance to testify. Obviously, I don't have every business that has a license's address or ability to communicate with them, but they do, and they would be required to do that. So hopefully that answers that part. But you and me we have phone calls, right? We can have a conversation.
Thank you, Councilor Arroyo. And is Francisco Fernandez looking to testify? Okay. We'll turn it over to Council President Flynn.
Thank you, Mr. Chair. I just wanted to respond briefly to these gentlemen here that spoke. Are we able to, I mean, they make good points, and are we able to do a BPDA economic development assessment on the impact that this potentially could have on business owners of color, and not rush this, but at least do an assessment, at least do a study, and see what the impact would be. This gentleman made a point that he could end up losing 2 or 3 employees. That's a significant loss to someone's paycheck, paying their bills. So I would rather get this right and do an assessment and learn and study and support our businesses of color, and give them an opportunity to weigh in on the study, on the assessment. Is this something we could do with BPDA and the economic development team as it relates to diversity, equity? This is certainly an issue that we should be concerned about, especially as it impacts business owners of color. I think it's important, and I'd rather get it right than rush it.
Thank you, Council President Flynn. And what I would say, the way I see this conversation is the start of a conversation. There's no ordinance that has been filed to change any law. It was an idea that Councilor Arroyo has brought to the City Council floor to start exploring it. And as Councilor Arroyo has just mentioned, he's willing to have these conversations, not just with the panelists that testified today, but also our business community. Right, and this is, and as a small business owner, I want to make sure that we're being as supportive and analyzing as much as possible before we pushing or taking any type of votes here on the City Council. So let's have those conversations. I'm happy to, if there's any specific questions, like in terms of like impacts that we could get the BPDA to answer, I'm happy to propose those questions to make sure that we're having a clear understanding of what the impacts will have, not only on those that are purchasing or on the litter in the streets, but also on our business owners as well. So like I said, this is just the start of the conversation, an idea. We're not voting on anything. There will be a more robust conversation if this was to progress, but this is just the initial conversations. And I'll pass it over to Councilor Arroyo.
Just one thing on the analysis, those numbers too. I recognize that I think every business is going to say that these miniatures or singles comprise some percentage. It's going to be different percentages of their sales. I also recognize that we have over 70 establishments that don't sell singles or miniatures at all and are currently profitable and existing in the city of Boston. And those businesses have actually reached out. They have actually been on the news saying that if these restrictions exist for them and they're able to stay in business and they're able to operate, they actually think it's an unfair competitive advantage that other businesses are able to continue to sell singles and miniatures. And so I think the business community, as you say, there is a level of folks who are going to come in and say, hey, I already sell these and I would like to continue to sell these. there's also another part of the business community that says, I'm not allowed to sell these, and if I'm not allowed to sell these, then I think everybody should have the same rules. And so I just want to make sure we're not talking about any aspect of that like it's monolithic and like every business is in the same category or same place on where they stand on this specific thing, because many of them already can't sell singles and miniatures. They already can't. And if you want to speak to that, I'm happy to talk to you, Carlos, about that. But I also think we're queuing up. I'm not the chair. But I am happy to have a conversation with you about that point, because I have had people reach out to me and say, I already can't do this, and I want everybody to not be able to do this as well.
If I can speak, I'll go
Yes,
on record.
please.
So in response to what you're saying is, the number 70 is shocking, I believe it, but again,
That's the floor.
as you can see, not all the data is collected the way that it should be, so we're kind of blind here on actually providing data. But what I would say to that, and being in the business and knowing of some of those stores that don't have miniatures, there was significant consideration given to them when that became an issue at the neighborhood level, and they decided to proceed. And their business model at that point was adjusted based on that. So they were going to buy a store for X amount of dollars. Once it did not transfer with the full miniatures, they got an adjustment and a credit at that point, and they based their numbers and their model off of that. And that could mean, okay, instead of having a 5,000 square foot store, I'm only going to have a 3,000 square foot store. And so they didn't proceed with that caveat or with that clause with no conversation or for no reason. And so they're in there, and their models are based off of that, versus the other ones, like myself and folks that are here and that were here earlier, they're running their business given those sales. They're now adjusting and hoping that sales continue because we've lost revenue from menthol cigarettes. So I think that's the best way I can respond for it. They didn't proceed for no reason. They were already given some consideration and decided to move forward.
Just real quick, the licensure that they're talking about, the 7 licenses, most of those are community agreements that the licensees did when they did the transfers with the community just to get approved for the transfers, or a new license coming in. And all of them, they're not 100 mil and 50 mil. Most of those are all 50 mils on restricted sales. The new proposal you're offering now is to remove 100 mils and 50 mils out of both, all liquor stores. So removing 50 mils might be, maybe something that some of us can deal with, but removing both would be a big effect on all business in the community.
Right.
That's all.
No, thank you for that.
Thank you.
We also have people online. Yeah, but we're happy, Council Royo and all us, happy to have these conversations, and also if Council Royo choose fit, to hold another hearing to have a discussion with small business owners. So we'll go online now, and we'll start with Joel DePina. Joel DePina. Please state your name and any affiliations.
Hi, good afternoon. My name is Joe DePina. I'm just a community activist, a former candidate, and someone that is a small business owner myself, and that's not in a brick and mortar. So I can't imagine what the people that are in brick and mortar, what they're going to go through. My biggest issue with this ban is the fact that there's many different aspects that nobody's looking at as far as the business-wise, the mental health, the medical issues. We have people that are alcoholics. I come from a family, my father was an alcoholic. My father had issues with drinking and beating on my mom. So we ended up with domestic violence issues. So I understand the effects of alcohol. I also, one of those people, I do not really like to be around people that are totally intoxicated. I get it. However, I have to look at the other moral issue of it is these people that have alcoholism, they depend on a nip. I know people that literally buy 5 nips a day, and I'm going to call them nips because I don't feel like I should call them anything else. I call them nips, and it was never, to me, it was never any issues with it, so I'm not going to change that now. But nips are what they depend on. I know people, they buy 5 nips a day, and they control their drinking with the nips as well. Yes, I understand there's big issues with nips being thrown around and the bottles, empty bottles being thrown around all throughout the neighborhood. I complain about it all the time. But it's not just nip-sized bottles, those 50 mLs. It's also the quarter pints, the pints. It's also trash and everything else that's in our neighborhood. However, what I noticed about the biggest issue that we should be working on is getting bottle returns on all these bottles. I understand that the small bottles from the woman that spoke earlier from Hyde Park, and that the small bottles are not able to be recycled. But I think in 2023 by now, there should be a way to figure out a way to recycle them bottles or something to do with them bottles. However, I think that should be the main focus that Ricardo should be working on, is figuring out how we can get bottle returns. Because I have a big tequila bottle right in my kitchen, and I went to go look at it to see if it was even, if I could return it for 5 cents. That one doesn't have a return at all. There's some that have return. You can go to Maine, I think California, everywhere else. Massachusetts doesn't recycle alcohol bottles, most of them at all. You only take beer bottles. But if you talk about taking out single nips, there's single beers that are sold. All these things. But the other aspect of it for me is the business-wise. I worked in the industry. A lot of you all don't know my resume. A lot of you all just look at me as that's just Joa. But Joa comes to you with the knowledge of a lot of things because I've worked in the liquor industry. Liquor stores make the most money off of selling the smaller bottles. And that is the nip size bottle. Because the other bottles they sell, they only make, some of them, they only make pennies on $1 to each bottle. Like when you get to a big bottle, like let's say a bottle of Hennessy, which is a fifth, consider 750 ml, they barely make any money on those bigger bottles. So when Ricardo talked about, oh, they make more money, they'll make more money selling the bigger bottles, that's not the truth. That's not the truth. So I need you, Ricardo, to look into those things and research those aspects before you speak on them, because at the end of the day, the liquor stores are the ones, the owners, they're the ones that know what their profit margins are and what they make money on. So I don't think it's fair for a city councilor that doesn't own a liquor store, that doesn't understand the business totally, to assume that a liquor store is going to make more money selling a bigger bottle. And for those reasons, I stand with keeping the nip-sized bottles, and we need to figure out, like the gentleman said earlier when he first came on to testify, we need to figure out how to work around community and how we can make it that we can keep our community clean and we can keep those bottles off of our streets and off of our sidewalks. Because all we're doing now is once we get rid of those bottles, we're just going to find the next size bottle out there. We're also going to force these people to drink more alcohol a day than what they were normally able to consume a day. So therefore, it doesn't make sense to me. I feel like, Ricardo, we have major issues in the city of Boston to take care of, like the gun violence, like the drug use, the needles, and all those other things, than worrying about getting rid of or banning nips from being sold. And like I said, the only people that are going to get affected.
Thank you, Joe. Thank you for your
small
testimony.
Businesses again. And I think, Ricardo, please, don't do this. It's not cool.
Thank you, Joe. Thank you for your testimony. Next, we will go to Martha M. Martha M., if you're still in the room, okay, please raise your hand and accept the promotion to panelist. If Martha M's not ready, we'll go to Victor. And in order to testify, you need to accept, approved to be a panelist. All right. We'll keep on going down the list to Kiana Giselle. right, we'll keep going. Jose? Look, we have someone. Please state your name and any affiliations. Yes, please state your name and any affiliations.
I don't know if he knows he's on.
Yeah. Is that Jose? Get out. Can you hear us, sir? All right. We'll go to Rudy Perez. You know what? If you're looking to testify, please raise your virtual hand, and then we'll call on you. So if you're looking to testify, please raise your hand.
What's crazy is he accepted becoming a panelist. Like he had to hit the button.
By the name of Zoom user, and they have their hand raised, but
Okay.
we can't call on someone
you
that
gotta
didn't
change
register.
Right. And there's someone on here registered as Zoom user, but if you don't register to testify, we cannot call on you.
My guy is back.
All right. Do we have any new hands raised?
Alan Robinson is on there. I think he talked to Luke. He wanted to testify, but
All right. Is Alan Robinson looking to testify?
Yes.
All right, there we go. Please state your name and any affiliations.
Just bear with me a few seconds, please. My name is Alan Robinson. I'm a resident of the town of Falmouth on Cape Cod. I co-founded a group in Falmouth called Litter Free Falmouth. Our goal is the same as our name, Litter Free Falmouth. In 2018 and 19, as a member of a group called the Falmouth Litter Reduction Team, we surveyed litter in Falmouth along Falmouth's roadsides. The results of 20 such surveys are provided in a data table that I emailed today to Councilor Arroyo's staff member. The finding that stood out from our survey was this: 33% of the litter items counted in the surveys along Falmouth's roadsides were alcohol miniatures. 33%. Following the surveys, we went through a deliberate process of engaging the Falmouth community. We held a listening session attended by representatives of 9 of the 17 Falmouth businesses selling liquor by the bottle. We made presentations at select board meetings and public forums. We have a town meeting form of government. We submitted a petitioner's article placed on the spring 2020 town meeting warrant for a bylaw to ban the sale of alcoholic miniatures up to and including 100 milliliters in size in Falmouth. Town meeting voted its approval of the article at the delayed town meeting in September 2020. The ban went into effect October 1st, 2021. Falmouth was the second municipality in the Commonwealth to pass a NIP ban, a miniature ban. We followed and learned a lot and very much appreciate the leadership of the town of Chelsea, or the city of Chelsea, on this. The positive effects on our roadsides, parking lots, parks, and other public spaces is dramatic. Virtually everyone I speak with about litter in Falmouth remarks on this improvement. They are seeing so many fewer alcohol miniatures. In late winter 2023, I began doing total litter and alcohol miniature surveys along an arterial roadway near my home. Alcohol miniatures now represent about 6% of the litter items collected. To my knowledge, this is the first before and after alcohol miniature ban data anywhere in the Commonwealth. And I plan to continue these surveys. The bottom line that we've seen in Falmouth is that we see every day in Falmouth is that nip bans work. And we support the city of Boston in its consideration of doing the same. And we wish you all the best.
Thank you. And we'll call on Yamilka Fernandez. And before we close out, I just want to give everyone on Zoom another opportunity. If you're looking to testify, please raise your hand. If you're in a car. Raise your hand. All right. Rowdy Perez, raise his hand. All right. And Rowdy Perez.
Hello, can you guys hear me?
Yes. Please state your name and any affiliations.
Hi, my name is Rowdy Perez. I live here in the city of Boston. I am a former youth leader with nonprofit organizations here in the state of the city of Boston. I've been here since 3 o'clock, and I've been hearing a lot of good news about Chelsea. But the reality is that Boston is not Chelsea. We're bigger, there's a lot more people here, and the city's getting gentrified in Chelsea. The city of Boston, people are struggling with money every week, every month, and by taking away the single bottles and the 50 millimeters, there wouldn't be any changes. I do believe from the bottom of my heart that it's more responsibility of cleaning, putting more trash bins out there in the streets. You could drive down Columbia Road, Loho Ave, and you will see a dumpster or just a trash bin every mile. Where can people throw these bins, this 50 millimeter bottles, these single bottles that you guys are referring to about? Not only that, we're struggling to make ends meet, and you guys, by referring to take these jobs away from people, because honestly, I don't believe, for what I've seen in liquor stores, that they can keep up with more employees. Taking away something that people could afford to just force them to buy bigger bottles. Drinking and driving is not okay. But if you force them to buy a bigger bottle, do we really believe that that's going to stop them from drinking? Do we really believe that they're going to stop throwing it away from the windows in the road? It's something that we got to take into consideration. Right now, there's a lot of people I know who are looking for jobs. And the last thing we need is to force business, family liquor stores, small business owners into a position where they need to get rid of other employees. And myself as a community member, hey, sometimes I want I want a 50 millimeter bottle because I don't want to drink a big bottle at the end of my shift. I work 2 jobs. You guys are going to force me to spend more money on a bigger bottle when that's not what I'm looking for. I want to thank you guys. Felix Arroyo, I'm so happy to see you there in the panel. I've worked with you when I was my younger teenage age. And I know that you know the struggle of the communities that we're going through here. And we need the jobs. We need the jobs. Thank you, guys.
Thank you. And with that, that is the closing of this hearing. I want to thank all the public for their testimony and all our panelists and the administration. This meeting is adjourned.